Okay. Oh, okay, ma'am.
Right. Good morning, all of you. I hope I'm audible to everyone. Hello?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Right. Okay, so I have posted one YouTube live channel here in the chats. All of you just see it, ma. And this meeting, whatever we are doing today, it is going to be streaming online on YouTube. So I've sent the link, I shared the link where it is going to be posted. Please post it in your groups. Okay?
Okay, ma'am.
Whoever people, I mean, in your groups, if you post, some people who cannot join this meeting can also join. Okay?
Okay, ma'am.
Yes, Pavani, are you here? Pavani, zoology faculty. नहीं हुआ?
Good morning, sir.
Good morning.
Good morning.
हेलो हेलो सर आपने ज्वाइन किया सर?
ఇది నాకు అర్థమైతలేదు అంటే ఇది వచ్చింది కానీ వాయిస్ వినిపిస్తలేదు
అమ్మా నిరూప
हाँ सर हाँ मैडम
ఏమైంది వచ్చారు అందరూ
వచ్చారు. ఐఎమ్ జస్ట్ వెయిటింగ్ ఫర్ జేఎస్
ఎస్ మ్యామ్
ఎవరు జ్యోతిర్మయి వచ్చినారా?
మన జేఎస్ గారు పిలవనా జేఎస్ గారిని?
ఒక్క నిమిషం మేడం, ఒక 5 నిమిషాలు మేడం, ఒక్కటే 5 minutes. దెన్
మీ రిసోర్స్ పర్సన్స్ కూడా రెడీగా ఉన్నారు. జేఎస్ గారికి ఫోన్ చేస్తాను. స్టార్ట్ చేసేద్దాం 11 అవుతుంది కదా.
I have joined already.
గుడ్ మార్నింగ్ సార్. గుడ్ మార్నింగ్.
గుడ్ మార్నింగ్ సార్.
అమ్మా మహేన్ నిరూప
Good morning, sir.
స్టార్ట్ చేయమ్మా.
సార్ గుడ్ మార్నింగ్ సార్.
Good morning. Good morning.
నిరూప ఓకే.
గుడ్ మార్నింగ్ సార్.
Good morning. Very good morning, all of you, please.
Conducting a webinar on this COVID-19, sir.
వాల్యూమ్ వినిపించట్లేదు చూడు.
Some NIN Ayurvedic INs and all. So they are on speaking on different topics. So because it should be useful to everybody, I have made it a live session, sir. And the thing is, the scientists are also waiting here. And just I want you to inaugurate the session so that we can carry on with the things, sir. Thank you so much for joining, sir. And I want you to please inaugurate and give a hosting.
Very good morning to one and all, my dear friends. Before we start, we have very senior most scientists from NIN. I request the moderator of the session, it might be JETCO or principal, see that everyone goes into the mute mode. Otherwise, it will be a kind of huge cross noise. Okay. So it is the duty of the person who is handling the entire show, particularly the Zoom show. Every time you have to go and see that they are in the mute. Otherwise, you can also mute it since you have the ownership. Okay. Can I go ahead, Principal Ma'am?
Yes, sir.
Yeah, thank you very much, my dear friends. At the outset, I congratulate the principal of Mahindra Hills, Dr. Nirupa, and faculty members, Ms. M. Jyotirmayi, and the General Coordinating Officer of the South, Dr. Rajini Ma'am, and OSD Banu Prasad, and all the faculty members and students for making this a wonderful session by inviting very eminent scientists for this nutritional aspects, Ayurvedic perspectives, and preventive measures of COVID-19. As a biotechnologist, I feel this is a very apt title, whatever you decided, my dear friends, because as you know, several biologists are there in this group. We do not have any medicine for the this coronavirus or COVID-19. Whatever we have to come out is only with the vaccine. I am not sure. We hope that vaccine will come soon in the maybe end of this year or at least early next year. But again, we are not sure. Just we are hoping that. but the only thing in our hands is we had to make, and we had to take a very good nutrition, and we had to take lots of preventive measures. And I always love these Ayurvedic preparations, whatever they're the medicines. I still remember the way back in 1998, I was in a meeting, I was in a workshop in Delhi. Suddenly, a news came out stating that Karela got patented by the American authorities. Karela is a Mamanica carentia, all of you know. It has got anti-diabetic property, and everyone knows that it has got anti-diabetic property, but no one has recorded it. Somewhere again, America told that our scientist has proved that it has got anti-diabetic property. Unfortunately, is in Indian traditional medicine, we do not have much documentation on what about the antiviral properties or anti-diabetic properties or whatever the health issues related to the product on this produce. So I think today's discussion will definitely help you out. What are the different foods or what are the produce, natural produce, which has got a very good medicinal properties and also have antiviral properties and preventive ways, and more top on this, how best you can improvise your nutrition. I especially thank Dr. Santosh Kumar, scientist C of Drug Toxicology Division, National Institute of Nutrition, for awareing all the people today on preventive measures of SARS-CoV-2 infection. And I also especially thank Dr. Raja Srivasan Mamidi, scientist from Clinical Epidemiology Division, nutritional, taking a topic on nutrition prevent COVID-19. And Dr. Sekaram T, research officer, and also special thanks to the moderator, Dr. Devraj JP, who is a clinical epidemiologist from NIN. So I really congratulate the team for their wonderful job. So I wish you all good luck. I thank one and all for coming forward to take this session. Thank you very much. Thank you very much. And I will see you later. Thank you very much. Bye-bye. Nirupa? Hello, Nirupa? Nirupa?
Sir. Sir.
Is it okay, Nirupa?
Yes, sir. It's okay, sir.
Whether, whatever I just delivered, whether everyone has listened that or not.
Yes, sir.
Yeah. So, thank you very much, my dear friends. Okay. I wish you all good luck this session. Okay. One and all, my dear friends, before we start, we have very senior most scientists from NIN. I request the moderator of the session,
YouTube start చేసినట్టు.
Everyone goes into the mute mode. Otherwise, it will be a kind of huge process. So it is the duty of the person who is
Nirupa, invite scientists, ma. Nirupa.
Yes, sir.
Invite Chema. What are you doing?
of Mahindra is Dr. Nirupa.
Mute lo pettu needi. Mute lo pettuko first. You please mute it yourself.
No, sir is calling me, no? That's it.
Dr. Rajini ma'am and OSD Banu Prasad and all the faculty members and students for making this a wonderful session by inviting a very eminent scientist for this
YouTube మాకు వినిపిస్తుందమ్మా, మ్యూట్ లో పెట్టు నువ్వు.
Perspectives and preventive measures of COVID-19. As a biotechnologist, I feel this is a very apt title.
Nirupa,
my dear friends, because as
mute
you know, several biologists are there in this group. We do not have any medicine for the
మ్యూట్ లో పెట్టు నిరూపా నీది.
coronavirus or COVID-19.
Please mute it.
We have to come out is only with the vaccine. I am not sure. We hope that
Nirupa, can you hear me? Nirupa, can you hear me?
Hello, Rajini ma'am.
Yes.
Yes, ma'am.
మీరు మ్యూట్ చేసి మాట్లాడండి అమ్మా, లేదా ఫోన్ లో మాట్లాడండి. వాళ్ళు స్టార్ట్ చేశారు కదా.
అదే మా ఈ అమ్మాయి ఆన్ చేయట్లే అది ఇంకా
ఎవరు ఆన్ చేయట్లేదు, ఎవరు
మ్యూట్
దగ్గర మీరు
పెట్టట్లే.
సైంటిస్ట్ అందరినీ పిలిచి మీరు గట్టిగా మాట్లాడితే దే ఫీల్ బ్యాడ్ కదా.
నో షీ ఈస్ నాట్ లిఫ్టింగ్ ది ఫోన్ సార్, అందుకే
No, no.
ఇన్వైట్ చేయమ్మా,
Madam, unmute అయింది చూడండి మేడం.
ఇన్వైట్ చేయండి అమ్మా.
Right. Sir, Devraj sir, can you please come online, sir? You can unmute yourself. I'm not able to find you. I think it is NIN ka thing say you have done. So please come on the line, sir. Unmute yourself and please come, sir. Yeah. Thank you, sir. Thank you so much. And welcome to the speaker. I'll hand over the session to you, sir, so that you can introduce your scientists and all, sir.
Okay. Madam, good morning, one and all. First, I would like to thank Praveen sir and convener Nirupa madam for giving this wonderful opportunity to talk with students. So we have with us Dr. Santosh Kumar. He is a very dynamic in action. He is scientist working at Clinical Division, National Institute of Nutrition. He will talk on preventive aspects of on COVID-19. And we have with us Dr. Raja Shishwan. He is a young, energetic scientist from NIN. He will talk on nutritional aspects for COVID-19. First of all, I would like to give some brief introduction about this COVID-19. COVID-19 is a coronavirus disease caused by severe respiratory syndrome coronavirus 2, that is SARS-CoV-2. These coronaviruses are enveloped single-stranded RNA viruses that belong to family Coronaviridae. The infection has spread almost more than 188 countries and infected more than 80 lakhs people and killing more than 4,37,000 throughout the world in a matter of 6 months. The first outbreak was confirmed in Wuhan, China in December 2019. On 11th January 2020, first death confirmed by coronavirus 19 in China. The first confirmed cases from outside China was from South Korea and Thailand. On 30th June, January 2020, WHO declared it as a health emergency of international concern. And it declared on 11th March as a pandemic disease. When come to the Indian scenario, 30th January, the first case was confirmed from Kerala. Subsequently, second and third cases were confirmed from Kerala state. Those have a travel history of Wuhan. So till now, in India, 381,091 cases were confirmed with this virus and 12,604 deaths have been occurred. So now I would like to invite Dr. Santosh Kumar, give some thought, give some inputs on preventive measures of this COVID-19. Now over to Dr. Santosh Kumar.
Yeah. Good morning, one and all. I think I'll talk without mask for time being, so that it would be a virtual talk, because we are interacting with the students and they are the future of our next generation.
No.
Is it audible? Hello?
Yes, sir, it is audible.
Yes,
Yeah. So at the outset, I would like to thank few people before we go into the exact topic. Dr. Balram Bhargav, Secretary DHR and DG ICMR, and Dr. R. Hemalata, Director NIN, and Dr. Bharti Kulkarni, the Senior Scientist and Head of the Clinical Division. This is from our end. And coming to the from Telangana State Social Welfare, I would like to thank Dr. R.S. Praveen Kumar Garu, IPS, so who has given us constant support in organizing and conducting our studies at the ground level, mainly in anemia and the probiotic what we have recently completed. At the outset, I would like to thank you, sir, on behalf of the NIN and the ICMR also. The second person, the Joint Secretary, Dr. Praveen Garu, who has given a brief introduction of the scientists from NIN. I would like to thank you and your team, the OSD and other members, and a special greetings to the principal, Nirupama Garu, who has made an effort to organize this particular event and at the same time to have it on the YouTube live. Thank you very much, one and all. So I'll just try to share the screen, the slides, some of the slides which are prepared. I'm not going to talk anything new about here because all the things, because from past couple of months, we are hearing regarding the COVID-19 and what are the preventive measures we are supposed to take. Yesterday, actually, I was having a chat. I was having a chat with my son. I just asked him actually what he understood about Corona. Then he said that and we have a lot of holidays here and we can enjoy and many things. Food festivals are we are enjoying the food. This was the statement given by my son. A husband. What do you understand by Corona?
Mommy, open say, mommy. मैं किंडर पट्टूंगी एक प्लेट तोड़े बतोड़े चलती तोड़न
Sound is there. Can you?
NIN choose
Ma'am, are you all ready? Biscuit రెండు ఒక పెడితే ఏమవుతుంది చెప్పు మ్యామ్ చెప్పు రెండు బిస్కెట్ ఏమంటాము
Two biscuits.
Can you mute all the participants?
So can you mute all the participants, please? Can you able to hear some background? Yeah. Next slide. So whatever the points I'm going to cover here are mainly taken from the WHO, ICMR, Ministry of Health and Family Welfare. Some of the guidelines given by the Telangana State Health Department, ICMR, NIN, and some media coverage is also there. And some of the images are taken from the WHO site and the Google. So I would like to clearly state here, because we being on the central government and we are the main key stakeholders working on the Corona. So I would like to clearly mention that no statement is made against any individual or government or central or state policies. This is like a mandatory thing which we are supposed to put it under the disclaimer. So during this particular few months, if you see clearly, actually, we have come across few words actually which are very new to us. One is lockdown, that is on has said this particular at 8 o'clock he has addressed the nation and said about this lockdown, which was very new to us. And followed by that, we had different phases of lockdown: phase 1, phase 2, phase 3, and phase 4. And now we have started and we have come across the unlockdown 1.0. So this lockdown, the main reason for this lockdown is we are preparing ourselves to fight against the pandemic. So we were not prepared initially. So because we had only one testing lab, that is NIV Pune, and later on in order to build our resources, in order to build the HR team, in order to make everyone familiarized and aware of the ground level situation. So this particular lockdown was given in a phased manner, and during this particular lockdown, a lot of awareness programs were created by the state government, by the central government, and different NGOs also. The another word which we have come across is containment zone. So when the initial days in the March ending or April, when we heard of this particular word containment zone over the news or various TV channels, it was a very panic situation. So what is this containment zone like? It's something like fear. Some people develop palpitations. So here, like if you find someone positive case in one particular area, that area was completely blocked. Over a kilometer. Initially, it was like 1 kilometer. Later, it was 500 meters. Now it has restricted to 250 meters. So this was initially we were not able to understand it clearly, but now I think most of us are familiarized with these particular words and understood the importance of these particular words. And this is the most searched word on the Google also. And followed by isolation and the quarantine. These are the other words which we have normally used by most of the politicians or the doctors or the normal persons. Suppose if test, then you are asked to be isolated in a particular house. And the quarantine, that is, it is mainly created by the government, that where you will be placed and you will be under constant supervision by the medical team. You will be checked every day for any medical symptoms, or at the end, you will be released from the quarantine area if you are symptomatic free. Next slide. So one important question I always ask myself, and I ask my colleagues also, like, who is stronger, like humans or virus? So it is very like simple question. It appears to be very simple actually. What is nothing, not very significant. Also, some people may feel that. But if you see all Vedas or Bhagavad Gita or Bible or Quran, anywhere it is clearly mentioned that on the world or in the nature, who is the most powerful are the humans. If you see the virus, actually, you cannot see the virus. You cannot able to weigh the virus also. It's not possible to see with the naked eye, but still it is ruling your life. It has made your life very horrible from past couple of months. Now, in spite of the medical background, in spite of the available technology, we are not able to handle this particular virus over a couple of months. But now we have able to understand its pathophysiology a little bit, and we are able to understand its properties and how it is exhibiting the different, how the changes are occurring. And this has gave us some sort of knowledge, and we are trying to find out some sort of vaccines and or treatment part medicines against this particular virus. Yes, everyone should feel that we are stronger. I mean to say that humans are stronger when compared to virus. We have the brain to initiate the work in a significant way to contain the virus. And the second statement, this one I have heard from one of the senior most scientists, and which I liked it and would like to quote here, is like, respect all, suspect all. It was a very beautiful statement given by one of our senior scientists, and I felt definitely we should follow this actually. Irrespective of gender or age, everyone should respect everyone. At the same time, you have to suspect, because the situation is like that. Because over the couple of months, we could see that we cannot able to find out whether who is symptomatic or asymptomatic. So it's a very pathetic situation at the ground level. So definitely to be cautious, to follow the preventive measures, everyone has to suspect everyone, at the same time respect everyone. Nobody is safe or until everyone is safe. These are small quotes. And this particular last statement, what it is mainly for the students, because you might not heard of this particular sort of situation never before. Even not you, even the scientists read something around in 1918, that was a Spanish flu. Maybe our senior colleagues may be having knowledge about it, because they could have come across some of the things in the newspapers about this. But for us, it is very much shocking. Sometimes we feel that as if we are going through any dream. So we have to adjust to the current situation. We have to rededicate ourselves. We have to redefine ourselves and reinvent how to tackle the present situation. Next slide. So ICMR has taken this challenge, and the government has enough trust on ICMR, and normal public also has enough trust on the ICMR. And ICMR has slowly developed the testing capacity over a period of time. Started initially in the March, the less number of, like, overly gradually, depending upon the situation, we are able to handle the situation. And now if you see up to 17th June, around 62 lakh samples have been tested. And now testing capacity per day has been increased. Initially it was in thousands, now it has come in lakhs. It is now as per on 17th June, it is 1,65,000. Coming to the labs also, we have gradually increased. Initially, as I earlier mentioned, Even in the today morning, one of the meeting also, Dr. Harshvardhan Garu, the Honorable Minister, he also mentioned that initially we have started with one single lab, that is NIN Pune, and slowly, depending upon the situation, understanding the situation, we have built up a number of labs. Now it is 953 labs. And in Telangana, if you see, we have around 10 labs which are doing this RT-PCR testing. Mainly, it was started with Gandhi initially in the March, and later on, taking the workload, it was slowly expanded with the taking help of the other hospitals. Now it is now the testing is being done at Gandhi, Usmania, Fever, IPM Hospital, ESI, NIMS, CCMB, CDFD, and Kakati Medical College, Warangal. And a couple of days back, even the state government has also given approval to some of the ICMR approved and NABL approved labs, and something around 18 labs. Yesterday only, I spoke to one of my friend who is the OSG for the Director of Health, and he stated that around 15 to 16 labs have applied for the permission, and today most of them already started that. Coming to the NIN, like what is the role of NIN? Most of the students or even the normal public are not aware that NIN is not a separate institute. NIN is an ICMR family, and NIN is one of the biggest and oldest institute under the ICMR. So the role of NIN here is, what we are doing here is two important contributions from NIN. The first one is in the March, we got a call from our Director General, Dr. Balram Bhargav, that NIN is going to act one of the regional depot center. So that means we are going to receive the kits from the ICMR, and we are going to distribute this RT-PCR kits to all the different labs or hospitals in the Telangana to do the testing part. So if you see all the hospitals like Gandhi or Usmania, whoever doing the testing part, that is mainly the RT-PCR testing, the kits are supplied from the NIN. Initially, we have started with one particular team, followed by a couple of teams are working on it. The second one is the National Sero Surveillance Study. So our Director General has clearly mentioned that let us know what is the community transmission of this particular coronavirus. So this particular thought has led to do one national sero surveillance, and it was a pan-India study, and around 60 districts were planned initially, and later on it was increased to 83 districts, and our sample size, around 24,000 subjects were involved here, and we have, in Telangana, we have included 3 districts, mainly the Nalgonda, Kamareddy and Janagam, and from each district, we have collected around 400 blood samples, and it was tested for the IgG antibodies to know that the particular individuals are infected in the recent past. And to our knowledge, and with the data disclosure, we came to know that in Telangana, like only 4 cases were positive, 2 in Janagam, 1 in Nalgonda, 1 in Kamareddy. That means from this particular data, we can say that there is limited community transmission in the villages. Another study we have planned in the Hyderabad, that is in the containment zones. So in the pan-India, around 13 hotspots have been taken, and already our Director Madam has addressed to the media regarding this particular survey, and it was covered widely by all the media. But still, for the students who may be not aware of it, for that sake, we are just highlighting the things. So in Hyderabad, we have taken the 5 containment zones, and our team, each team has gone to different containment zones. One is Adibatla, Balapur, Tapachiputra, and Channanagar and Miyapur. And in each containment zone, we have collected 100 samples, and we have tested for them, and we are awaiting for the results officially. Next slide, please. So I think this part already Dr. Devraj has covered regarding like why WHO it has considered as a public health of emergency and the pandemic, because it has crossed more than 100 countries. When it is crossing more than 100 countries, and definitely it comes under the pandemic situation. And as of now, we can see around 214 countries are involved. And these are the statistics. You can also visit our website and you can see the statistics. The most important point in the inaugural part only, Joint Secretary has already stated that we don't have any specific treatment or vaccine as of now available. However, many vaccines are under trial, many drugs are under trial. they are in the different phases. Some are in the animal studies, some are in the like human phases, like what we call as phase 1, phase 2, phase 3, then phase 4, then it comes to the market. So majority of the vaccines are in the phase 2 and phase 3. So we are expecting in the early Jan, Feb, at least the tentative results, and maybe it will be available for the most of the people. As far as the Indian government is concerned, the Ministry of Health and Family Welfare is revising the guidelines regularly. And on June 13th, we have received one recent guidelines, like how to manage COVID patients. And in that, it was clearly mentioned that what are the drugs what we are using as an investigation therapies, that is remdesivir, tocilizumab, and convalescent plasma from patient. These are three therapeutic areas what we are looking at here. And in the brackets, I mentioned as emergency use authorization, EUA. The meaning of this particular is like any drug to come into the market, it has to be recognized by US FDA or it has to be recognized by our Government of India. Government of India, it is mainly by the Central Drug Standard Control Organization, which is mainly the head office, which is going to give the guidelines or give the approval. And the authority is mainly by the DCGI, Drug Control General of India. So because it is an emergency use, so it has not even got the US FDA approval, but still we could see in the some of the results trials that it has good promising results. Next slide. This is the Telangana statistics, which was taken from the official website of the Telangana government as on 17th June. Many people were saying that Telangana government has conducted limited testing, but they have followed the ICMR guidelines, and depending upon the need and requirement, they have conducted the testing. So initially, like what was the ICMR rule is like, if a person has fever, cough, difficulty in breathing, and a history of travel, before 14 days history of travel to any area from where if we have the positive cases. So that was the initial criteria. So the government has taken that particular criteria, and depending on that, it has done the testing. Later on, the testing was revised by ICMR and it was implemented by the state government also, that if a person has illness, like respiratory illness, and he has a contact with a positive person within the last 14 days, then that was the criteria. So that criteria stands good enough, and depending on that, they have done the testing. And now the criteria has totally changed now. If you see on the May 1st, Director of Public Health has given a clear-cut guideline to all the laboratories that SARI cases, I mean to say that severe acute respiratory illness cases, if that means a person having fever, cough, difficulty in breathing, and requires hospitalization, for them only the testing has to be done. So later on, because the cases were increasing and even the government thought that in the GHMC limits the cases are increasing. So now, a couple of days back, Honorable CM has given clear-cut instructions that within the 30 constituencies within the GHMC limits, 50,000 samples will be collected. So depending on this statement, the testing capacity has increased, and now we can see that positive cases are increasing. And on 17th June, that is 269 was the highest recorded. But yesterday also it was the highest recorded. We can say that it is crossed 359 cases officially. It was there on the website. And if you see the last point in the cumulative and the disease, the death, total deaths recorded in Telangana government state is 192 officially recorded. And in the brackets I mentioned as DM, diabetes mellitus, and HTN, that is hypertension. I mean to say that the most of the deaths, if you clearly examine them, they were having the comorbid conditions. That means they were having diabetes, or they may be having hypertension. Some were having cancer, some were having cardiac problem, some were having GIT problems, and some were having the nervous system problem also. So I mean to say here that a person without comorbidities is definitely will not land up into this particular area. So the persons who are having comorbid conditions should be very careful when they go out. Next slide, please. So coming to the exact topic, that is preventive measures. I think this part has been widely covered from the government side. Website. awareness programs. The first one is the social distancing. Initially, we used to call it as social distancing. Now, people are trying to use the word as physical distancing. So, what we understand by this, because this particular virus transmission occurs from humans to humans. Initially, what we said is it was from the bats, and later it has from the humans to human transmission is occurring. If a person coughs, if a person talks, definitely there is a chances of droplets coming out, and you are exposed directly. So definitely you are supposed to maintain a distance. If you see exactly in the guidelines in the March or April, we, as per the, depending upon the literature, we said that at least you maintain a distance of 1 meter or 3 feet. But then after that also people went to that, and people were used to get this particular infection. Then the guidelines were revised and they said that at least you maintain distance of 2 meters or 6 feet. So at least we try to maintain a 6 feet of distance. That is the depending upon the evidence or the review articles, we have come across this and we have given this particular instructions. But there was a there was again another paper on this particular physical distancing, and they said that this particular virus droplet can at least move beyond the 6 feet. That means up to till 20 feet. So that was one particular publication, but still we need to have more number of publications, but at least try to maintain a 6 feet of distance, which is very much useful. The second important point is the repeated hand washing or use of sanitizers. So in the bracket, I just mentioned a movie name, that is Mahanubhavra, that like maybe one of the Telugu movie, where you can see the hero used to have this particular OCD symptom, obsessive compulsive disorder, where he used to regularly use the hand sanitizer. Now we should appreciate the director to having that particular thought, but now it has become mandate to everyone. Here, like we all of us do hand washing, and what is new in this? The hand washing part we used to follow just before the food or when we go to the washroom, and it was not very significantly followed. We try to use only one hand wash for the before eating, or just use a left hand when you go for the washroom. So, but now we have a clear-cut guidelines given by the WHO, and it is implemented by our Ministry of Health also, and even the state government is also promoting the same thing, that you are supposed to follow the proper guidelines. So washing with soap and water is ideal. When you go out where you could not find within the immediate reachable limits the soap and water, use the hand sanitizers. Washing also we have a specific guidelines that you have to do the specific hand washing, apply both the palms, the fingers should be crossed for the above and down, and you have to clean the thumbs and fingernails and top of the finger and wash it completely till the wrist. I have one of the image, I can show you that in the next slide. So this is the particular washing techniques, at least 20 to 40 seconds they say, but you stick to at least 40 to 60 seconds or at least 1 minute. Coming to the use of face masks. So this is very, very, very important. Initially, the guidelines were made that the person who was positive was using the mask, because from him there should not be transmission. Later on, the guidelines have been revised, and it has said that any person who is coming in contact with a COVID positive case has to use the mask. Now the government made it very clear that everyone should use the mask irrespective whether it's a positive or negative. I mean to say that in the first slide itself, I said that respect all, suspect all. That means we don't know, because the behavior of this particular virus is completely different. It is not a very classical viral behavior. So definitely you are supposed to use this particular face mask, and using the face mask, because recently also we have gone to villages, it is being implemented widely, but how to use the face mask, people are not following it properly. So you have to completely cover the nose, the bridge of the nose, the mouth, and the chin also completely, and sides also should be completely tight. But we have a habit of usually touching it or keeping below the nose, or if you go to some shops, it's completely placed downward. So these are all of the faulty techniques, more chances of contamination because you'll keep on repeatedly touching it. So you try to follow the proper guidelines. I'll show you one of the image in the next slide. The next important point is do not touch your eyes, nose, mouth, even the ears, which we have not mentioned here, even the ears without washing your hands. This is very, very important because we always have a habit of like taking care of extra cautious care to see your eyes properly, whether it's looking nice or not, putting the fingers regularly. Some people have habit of poking the nose. Some people are habit of, it appears to be like a attitude or just try to behave in that way, but at least during the particular situation, at least try to avoid all these things. Or still, if you're not able to avoid, please do hand washing or use sanitizer before touching these particular organs. The strategies in order to have the preventive measures, that is what exactly being implemented by the government is testing. So we are definitely doing the enough testing as per the requirement, depending on the present situation. The tracing part, we should appreciate the state government here. The tracing part has taken very good enough actually here. Like all the district medical health officers and district medical officers and all the doctors are involved in this particular team and to identify the contacts. So they are going there to the contacts and talking to them, and they are getting this all this positive contacts in 108 ambulance and properly taking care of them and taken to the respected hospitals and being tested. So it was a systematic plan. We should appreciate the Telangana state government that for this particular the treatment part, as I already mentioned that we don't have any specific treatment, but we have to go for the symptomatic treatment. In the symptomatic treatment, like if for healthcare workers or frontline workers, ICMR has given a clear-cut guidelines. Hydroxychloroquine, one of the important drug which is used over past more than 70 years, which was mainly used for the malaria. But now it is also having some benefit in the corona also. We have seen some observational studies, some sort of cohort studies, and in vivo data also says that definitely this HCQ has some sort of effect, and ICMR has clearly given some guidelines that to follow this prophylaxis, and already the Telangana state government has implemented that. And I spoke to my friends who are working as a medical officers in the PHCs. They have used this, that is 400 milligrams on the first day, 1 dose in the morning, 1 dose in the evening, and followed by weekly 400 milligrams for 7 weeks, and all of them are safe. There were few publications and few media coverages stating that this hydroxychloroquine has some sort of side effects like hypoglycemia or some sort of like cardiac changes, QT prolongation. But we have not come across this. However, 1 or 2 cases may be reported, but those who are having any cardiac issues, let them go for one ECG testing and let them see the QT interval, and depending on that, taking the advice of a physician, let them follow the treatment. And the teamwork, this is very, very important. The government is taking maximum care. At the same time, the respected organizations are taking maximum care, and it is the responsibility of the individual to also be part of the team. You should not separate yourself from the government. You are part of the government and you are supposed to work as a team with the government, and you're supposed to be supportive to the government. I mean to say that try to follow the measures, the preventive measures advised by the government on day-to-day basis. Similarly, the government already advised you people to download the Arogya Setu app. This is very important app. Once you download this app, it will ask you a few questions. You are going to answer the few questions, and it will also makes you aware of any positive cases in the nearby surroundings. You can yearly identify, and depending on this, you can take proper measures in order to protect yourself, your family, all these things. And tracking and monitoring is very, very important. So once a person, what do you understand by this incubation period? Suppose if you have come in contact with some positive case. So because some people have fear that when I may develop symptoms, so there are chances that within minimum time is 2 days to maximum time say 14 days. That is what we call as incubation period. And within this 14 days, you may get chances of getting symptoms. The contact time, this point is very, very important here. I would like to stress here that many people have asked me, like, I have talked to some sort of COVID positive patients. So whether there are chances of getting me infected. Then depending upon the available data, we could find out that if you're coming across any contact or any positive patient for 5 minutes or 10 days, you don't get any sort of, you're not exposed, or if you take all proper measures, you're not exposed to that. If you talk for 20 minutes, no problem. But if you are contacting a positive patient for at least 30 minutes and beyond that, even though if you take all prophylactic measures, there are chances of transmission. So I strongly recommend and stress here that even though if you come across a positive case, don't panic, maintain social distancing, use the mask, use the hand sanitizers, if possible, use the gloves also, not to touch the surfaces, and avoid face-to-face contact, less than 10 minutes or 15 minutes, so that you are safe. Next slide. So this is the slide. Actually, it is well representative, taken from the Google. If you see the first one, the nose is not covered. If you see the second picture, the chin is not covered. If you see the third picture, this is the routinely I have observed many of my junior friends who are riding on the bike, and definitely this sort of scenario I have seen that not using the mask properly. So it is a sincere advice to everyone that follow the proper method of using mask. Nowadays there are shortage of masks in the pharmacy outlets, so you can prepare home-based cotton mask. If you don't have any cotton mask also, you can simply use your hanky or any towel, small handkerchief, and you can use it completely. Next slide, Rahul. So this is clearly mentioned here. Wear your mask, so completely covering the nose, the mouth, and the chin, and there should not be any gap on the sides. And please don't touch the mask. We have the habit, we'll use the mask, we keep on touching it here and there, we'll use it like this, we'll drop it down, again we put like this. So all this should be avoided. I should not use this mask again. Once I finish this particular session, I throw this mask and go for the new one, because I tried this, it should not be done. Next slide. This is the WHO recommendation, and already government of India is already started implementing this, and we have started using it. And it is, since I think image may not be clear, but still you can clearly make out that palm to palm, between the fingers, back of the hands, the thumbs, back of fingers, fingernails, and the wrist. And I advise that after this particular session, it appears to be very simple, but practically when it comes to the hand washing, we don't follow this. Even sometimes, even I forget not following this particular scenario. But when you are going out to any supermarkets or any malls or any sort of gathering is there, definitely when you come back, you make an habit that you implement this particular procedure, and at least for 60 seconds. This is very, very important, but still, even though we have the knowledge, but the implementation is lacking. So that's why in the second slide, I clearly mentioned that rededicate, reinvent, redirect yourself so that you are more cautious and you can prevent the transmission. So you become the frontline warrior. You become the corona warrior in order to stop the transmission. Next slide. So this is again what I'm trying to explain you, the 6 feet of distance. It has been followed very well in some of the situations, but at one particular centers we could not find out most of the time is, next slide please. This is the sort of scenario what we have seen on the first day of when the government has announced that the next day we are going to open the wine shops. So this was the scenario what we have seen. And definitely, I recommend that it should not be done, and always definitely try to follow. In some of the states also, we have seen that there was no gender difference also. So we can see all the people standing in a line, and it was a huge crowd. So this is again the source of transmission from one person to other person. So I strongly feel that definitely there should be physical distancing. Coming to the symptoms, yeah, I would like to take some time here. This is very important slide here. So how to detect a person is positive? I have mentioned here some of the symptoms. Initially, some of the symptoms were not there in the Ministry of Health and Family Welfare, but on the 30th June, in the guidelines, the last 4 points have been added after some expert deliberations happened, and they also included these 4 points. Initially, it was not there. The symptoms were like fever, cough, or fatigue, or weakness, or chills, shortness of breath, expectoration, that is, cough may be coming out, myalgia, body pains, or headache, or running nose, or sore throat. Some of the patient may experience diarrhea or discomfort, loss of smell, or loss of taste. So all the symptoms. One important point here is it's not compulsory that all the symptoms to be present in a single patient. A person may represent only fever, 100 degrees of Fahrenheit and above, only fever, no other symptoms, can be COVID positive. A person is having only diarrhea, no fever, no cough, but still he is a COVID positive. Yesterday only there was one publication, it was stating that 42% of the transmission occurs through stool. So when you use the washrooms, when you use this through aerosol, there are most of the chances of transmission from the washrooms. So we have to be very careful when we are going to washroom. So clean your hands perfectly. So these are the symptoms actually. This loss of smell, loss of taste. These are the recent findings. What depending upon the data generated, and Ministry of Health also had a lot of discussion on this particular 2 or 3 points. That is rhinorrhea, diarrhea, and loss of smell, whether to include in the guidelines or not. But at last, after the high-level scientific committee deliberations, they have included in the Ministry of Health guidelines, which is published on June 13th. You can also visit the website and you can download that. So I mean to say that a person will have these particular symptoms. It's not mandatory that all the symptoms should be present in single person. A single person will have, or one symptom may definitely turn up into the COVID positive case. So one has to be very much careful. And we have some sort of risk factors also, like who are the people who are more prone to develop this transmission part. Age, more than 60 years are like more risk factor. If a person has some non-communicable diseases like NCDs, diabetes mellitus, or hypertension, cardiovascular disease, or chronic lung or kidney or liver disease, cancer patient, obesity also, like whose BMI, one of the journals also mentioned that findings, like it has been shown that obese people are more prone. We have taken the cutoff as 25, but in the Western they have taken as 40 also. The 40 is the cutoff for them. And immunocompromised, that means whose individual's immunity is low than required. So these people, like comorbid people, should be very much cautious, and when they are going out, they definitely should follow these 3 important measures. Physical distancing, using of the mask, and hand washing is definitely mandatory. If they are like very important or very emergency is there only, they have to go out, otherwise they can restrict themselves to their respected house. Next slide. So why I said that it is very notorious and why we are not able to come to a particular drug is, if you see any viral infection, you should have only the laryngitis or very respiratory infection, all these things with it. But sometimes it is behaving like a bacterial properties also. The reason for this, how you can say that we are using broad spectrum antibiotic like doxycycline, patient are responding. And if you see the ESR and if you see the CRP, there is rapid increase in the ESR and CRP. That means apart from the viral properties, this particular coronavirus, that's why I mentioned very notorious, also showing some sort of bacterial properties. In sort of infections, there should be a rise in the lymphocyte count. The normal lymphocyte count is 4 to 11,000. There should be a rise in the lymphocyte count. But typically, what we are finding here is lymphopenia. That means lymphocyte count is decreasing. CD4 count is decreasing. That means this particular virus is also having some sort of HIV properties. That's why in some of the trials, anti-HIV drug is working against the corona, because it is trying to improve the CD4 count, trying to improve the lymphocyte count. Why the reason of using the HCQ is, you can see the inflammation in this particular patients, this immunoinflammation, and because of that, hydroxychloroquine is having an effect in order to decrease the inflammation. So initially we are using hydroxychloroquine for only for malaria. Later, it was also used in chikungunya, people like who are having severe joint pains. Severe joint pains are mainly because of the inflammation. And when you start using the HCQ, the joint pains have come down. That means it is having a very good anti-inflammatory property. And this is one of the reasons why it is working out. And we have seen in some of the cases after the postmortem, there was a thrombus formation in the blood vessels. That means the blood vessels have been blocked. That means there was a decrease carrying of oxygen capacity. That means there is decrease in hypoxia. That means saturation of the person has come down. The normal partial saturation, the normal oxygen saturation level should be around 100, but 96 to 100 is also maintained. But if it is less than 94, then you have to be very careful. So it is advised that definitely one has to be very careful. The deaths which are occurring mainly because of two important things is silent hypoxia. There is a recent incident in the TV and Gandhi doctors have gone for an hesitation that there was a manhandling. When people were manhandling was there actually. The reason behind that particular case, when I spoke to my colleagues, the person was on oxygen supplementation and he was advised to maintain that oxygen supplementation, not to use the washroom and to use the catheter. But he has not followed that advice. He has gone to the bathroom and immediately in the bathroom, the saturation levels have come down. It has come down so drastically that it was below 60. Where you are supposed to maintain your saturation between 95 to 100, it has come below 60 and there was a breathing difficulty in the hypoxia and we call it as a walking dead phenomenon. That means the person will be walking, but saturation comes down, he is dead. So one has to be very much careful. Most of the deaths in the comorbid conditions is mainly because of the hypoxia. So one has to be very careful. And if it is hospitalized, definitely look at the urine output. Check the urine output every 6 hours. If the urine output is normal for every 6 hours, then definitely is improving. And if saturation is maintained, then definitely is improving. So these 2 points are very significant. So that's why I mentioned this COVID-19 as very notorious. Apart from viral properties, acting like bacteria, acting like HIV, so different types of properties, even the doctors and the scientists are not able to come to one particular conclusion. So, but still, the scientific field are developing the vaccines, targeting the different areas so that any one which is working out, definitely we can come out. So in India, like we have like 2 or 3 pharmaceutical companies, they had a tie-up with some US companies. So we are expecting at least by next 2021 in the early Jan, Feb, at least it may be available. Next slide, please. So these are some of the points one has to remember when you go out to the market. So this is well known, but again, I want to emphasize here that implementation. So redefine yourself, reinvent yourself in order to follow these particular points. Appears to be very simple points, but we don't follow practically. Sometimes even I skip some of the points. When I go home, when the kids come, definitely we try to hug them, we try to kiss them, which should not be followed. So leave the footwear outside. Anything what you're carrying, those who are like going to the market, store a separate place. Don't carry it completely to the different places. So kids, family members are advised that you should not come in contact with them. Do not touch the door handles or don't use the lift. If you're young, able to walk, try to use the steps. Elder people, if you're using the lift, be additional cautious. Use the sanitizer. Try to place sanitizers in each floor. We also did in our apartment. We have placed one sanitizer. So asking them to use the sanitizer each floor. I think same thing can be implemented in the hostel, that for each floor or at the each room, at least wherever it is possible, wherever it is comfortable, at least the stand hand sanitizer are available. Put a stand, put the hand sanitizer. So whatever it is required, you can use it. So this has to be implemented on a daily basis. So these are the routine things. Next slide, please. So these are some points which I specifically want to advise the social welfare department. I don't know how far it is going to be practically possible, but still I recommend that you try to procure a thermal scanner, which is costing around 3,000 to 4,000. But depending on the demand, the companies or the seller is increasing the price. But the government can make their own decisions. And the sanitizers, definitely it has to be placed in the hostels at the different places next to the room or at the washroom, wherever it is possible. In emergency use, if the person develops any sort of like symptoms like fever or weakness, at least they should have the paracetamol, B complex. Vitamin C, we have seen the role of vitamin C increasing the immunity. It is advised 500 milligrams of tablet per day or 1000 milligrams of tablet per day is also advisable. D3 also has shown some sort of association in improving the corona symptoms. So that can also be done. Zinc capsules and oximeter. This is oximeter is like you can place to the finger, you can check the saturation, oxygen saturation levels, and it is also costing you around 3,000 to 4,000. I think it is within the economical range. Thermal scanner and oximeter, if they can procure and place in the hostel on the emergency, because I said it's a walking dead phenomenon sometimes. Sometimes we have seen the cases, they don't present any symptoms. We have pre-symptomatic people, we have symptomatic people. Symptomatic people, they tell you, you can identify, so they can get treated. But there are asymptomatic people, because they feel they are comfortable, but you have to check the saturation level because it is a pandemic time. So definitely we have to so that you can identify the asymptomatic who are at risk also. So you can prevent the death. So very important instrument for some people, maybe at home also you can do it, or in the hostel also. At home also you can procure so that you can check the saturation levels. Apart from that, even the government is advertising that go for the regular breathing exercise to improve your lung capacity, or yoga. Warm water also has shown some sort of, because warm water, like if anything warm, the virus survival rate is very low. So warm water has some uses here, but still requires some sort of evidence to prove how far it is useful. Apart from this, the drugs, what I mentioned, like some antibiotics and oxygen cylinder in case of emergency if it is possible. But otherwise, thermal scanner or oximeter, definitely there is a requirement for these two instruments to be procured and to be placed at the hostel level. At the last, I mentioned that 10:10:10. So this is the latest GHMC implementation going to be happen under the leadership of KTR Garu. That is 10 Sundays, 10 p.m., 10 minutes, you work within your house or within your apartment, try to see that there is no pooling of water. We have the pots, we have the plates, any broken glasses or any broken things are there, there will be water storage, again, breeding of the all these parasites we can see. And so in order to avoid, because already we are going through one pandemic, if you see again outbreak of dengue cases, outbreak of malaria cases, it becomes difficult to handle. However, as per the literature, if one pandemic is going on, the other cases, increase of other cases are less, but still try to follow this particular formula. Even I liked it and I would like to implement this at my apartment level. A very good initiative, like 10 Sundays at 10 p.m., 10 minutes of time you can spend that in order to make the premises clean. Next slide, please. So these are some of the pictures that what recently we have gone for the survey, what I mentioned in my initial talk, the National Zero Surveillance Study. This is in one of the containment zone. This is the ICMR team visiting the particular house, and we advise them to use the mask, and we also try to maintain the social distancing. If you clearly see that we have taken all the precautions, and we have asked the subjects to sign with their own pen. We have not even given our pen to them. If we have given our pen to them, because we don't know, because of the containment zone, we have sanitized the pens also. And at the end also, whatever the forms we have collected, we have placed in a separate room. We have waited for 2 or 3 days, because there are studies that even on some surfaces, the virus will stay for a couple of hours, 2 days, 3 days or 4 days also. So we have taken proper measures in the containment zone. The reason for placing this is to emphasize that preventive measures should be followed by everyone, not only in the study purpose, but everyone has to follow that. Next slide. So this is the last slide, take home message, which we have already covered the same points. That is definitely redefine yourself, reinvent yourself, try to implement this particular points. Appears to be very simple, appears to be known things, but implementation wise, because recently also I have visited 2 of the government officers. There, it was lacking because they are following, but it was not that much implementing. The physical distancing was not implementing there. So I still advise that maintain the physical distance. Don't sit face to face, because when you sit face to face, there is a transmission, because if I talk to you, there is a transmission. So at least take a L shape, or in different places you can sit. Or if you're using an AC in your room, so it should not be projecting downwards. You see that the AC is placed upwards. The air is not coming towards you, upwards, so that it will not be less chances of transmission. You can't say that 100% reduction, but less chances of transmission. So all these things we need to follow. And the last, I would like to conclude my talk by saying that you can't go back and change the beginning, but you can move forward and change the ending. Thank you, one and all, and I hope that everyone will definitely, these are known points. I have not talked anything new, but I still emphasize that implementation is very, very important, which is what we are supposed to do in this particular pandemic time. Stay safe. Signing off, Santosh. Thank you.
Thank you, Dr. Santosh, for wonderful talk. Madam? Madam?
Sir. Sir.
So now I'll ask one question to Dr. Santosh. So Dr. Santosh, how frequently one has to use this hand sanitizer?
Hand sanitizer, like some papers they say at least 1 hour, some papers they say 2 hours. But as I said in the last slide, that you can use as frequent as possible. Because when you are restricting to yourself a single room, less chances of contamination, less chances of transmission. So in that particular situations, if you're using less number of times, but no problem. But when you're moving to the public places, when you're working in a government setup, whenever you can recollect, you fix it at least 1 hour, so that we make it mandate. It's not like how like every 1 hour is supposed to do. It's like you have to make yourself conscious, subconsciously, that you need to sanitize yourself. If you're touching any new paper, there are chances of contamination. If you're going out and touching any new, when opening the door or going to the washroom, there are chances of that. So whenever you use this particular paperwork or going out, so you try to do hand sanitize as much as possible. And you see that specifically because nowadays we can see that the sanitizers, some people are becoming entrepreneurs and trying to develop their home sanitizers also. But you try to see on the label that it has 70% of the alcohol content.
Thank you, Dr. Santosh.
Thank you.
Now,
Sir, do you want people to interact with you, or shall we go to the next lecture?
Yeah, you can interact, please.
You can interact, ma'am. If any questions are there.
Yeah, anybody who want to interact, kindly you can. Anybody who want to interact with Santosh Kumar sir, please interact. It's the time for you.
Good morning, sir. Thank you for this informative lecture. Sir, I'm Mohini, lecturer in genetics from Mahindra Hill, sir. Sir, I would like to ask you, if we go to a pharmacy and buy some medicines and other stuff, what would be the best way to sanitize them, sir? I mean, there is always a doubt. I mean, we have been sanitizing vegetables, fruits, and other grocery stuff, but would you just help us in helping us in finding out a way to sanitize our drugs or other stuff, sir?
No, when you are going to the pharmacy, it's normally most of the medications are packed one. Okay, so you try to use any gloves when you are trying to use any sort of medication. So keep it aside for some time, and then you can start using it.
All right, sir. Thank you.
Any more questions?
So here I would like to bring to the notice of everybody also, sir, like after in the session, during the chat session, I have given one forms also, it will be posted. So whoever has any queries also, you can post it to them so that it can reach Santosh Kumar sir or other speakers, anybody, whomever you want the queries to, they can answer to you later also. So if you can't reach now, it's okay. You can also interact them on the later using the Google Forms and all. The document will be sent to all of you. right in the meeting itself.
Okay, now let's move on to the next speaker, Dr. Raja Shishwan. He is a scientist at NIN. He will talk on nutritional aspects to prevent COVID-19. I will welcome Dr. Raja Shishwan.
सेम वही फाइल में this one first yeah full screen good afternoon one and all. Myself Dr. Raja Srishwan. I'm a scientist in clinical epidemiology division. So today's talk, which is on nutritional aspects to prevent COVID-19, I have just retitled as Nutrition Advisory for COVID-19 because there are a lot of conflicting evidence on what foods are actually useful to prevent COVID-19. As they say, there are smart foods, superfoods. So let's go through the aspects why nutrition is important in preventing COVID-19. Next slide. So this is the background of my talk, overview of my talk. First is the background. Then we talk about the overview of malnutrition. What is malnutrition? It's both macro and micronutrient deficiency. Then we speak about the overview of immunity, especially the innate and the acquired. Next is the malnutrition infection vicious cycle, how malnutrition affects infection and how infection could affect malnutrition. And then the balanced diet, which we need to be taking, and some conclusions in the end. Next slide. So we all know how dangerous coronavirus is now worldwide. You see that the mortality rate is 1 in 100. So in a population of 135 crores, imagining a mortality of 1% also.
Sir, one small thing, sir. Sorry to disturb you. Your PPT is not visible, sir. I think you have to enable your PPT. You have to show your PPT, sir.
It's 1 minute. Okay. It's please check. Okay. It's not being shared. We'll stop. Still, is it now? Is it now? Is it now being shared? Does anyone know?
No, sir. No, sir.
Okay, okay. Then again, one just. I think just stop sharing that. Stop sharing that. Hold. Stop sharing. And again, share. Close that. Go to meeting. Open it. Stop sharing again. Stop sharing again. Stop share. Now again close it and again share. Share screen. Meeting. Are you able to see? Are you able to see now?
No, sir.
Close down. Close.
Meeting. Pakan. First. First. కింద షేరింగ్ ఉందా
Resume slide show.
1 minute. Resume slide show. Is something being shared? What exactly?
Actually, some stuff close.
Share. Now I think it is shared. Yeah, open it.
Madam,
you are able to see now, madam?
Madam, is it okay now?
No.
No, sir.
Meanwhile, our side, Rajita and Pavani, if you can post the forms in the group in this thing, can you do it? Meanwhile, this will also be happening, no? Instead of posting it directly into this group.
Yes, ma'am.
Here and also on live YouTube also, you just post it off from forms and all.
You done the last live left. You share. Yeah. Share. Madam, is there any
Yes, sir. Yes, sir. It is.
Yeah.
Now it is
Great. Fine. So sorry for the delay. So my talk is about the nutritional aspects to prevent COVID-19. So this is the overview of my talk. Background. We are talking about overview of malnutrition, both macro and micronutrient deficiency. Overview of immunity, which is both innate and acquired. I'll explain what it is. Then the malnutrition, infection, vicious cycle. Then the balanced diet. And we have the conclusions in the end. Next slide. So COVID-19 outbreak, is one of the most serious disease we have now worldwide. So it has a mortality rate of 1%, which means for every 100 persons infected, 1 person will die. So that's the seriousness of the disease, which means in a population of 135 crores. So imagine the risk of 1%, even 1 person dying. It's a huge number. So therefore, we need to. That's the reason why governments across the world have now done lockdowns, partial lockdowns, complete lockdowns, and it has changed all of our lives, isn't it? All around the world in a very short period of time. It started so quickly in December, January, and in March, globally it spread, and now it's a pandemic within such a short period of time. So available evidence suggests that there is no race, age, gender, or geography is spared by the virus. It is spread across the world. It can affect any age, from infants to old age. So even infants are not spared, pregnant women are not spared. So there's so many people are at risk. And the most riskiest here are the elderly and people with chronic illness and comorbidities, especially as Dr. Santosh has previously said, cardiovascular diseases, cancers, diabetes, and hypertension. So they're all at increased risk of mortality and illness. So this is the reason we need to be very careful with this virus. So we should be understood. It's also important to know that being a communicable disease, non-communicable diseases are also playing a major role in this disease because of the comorbidity. Like if you have a hypertension or diabetes, you have an increased risk of getting severe illness like pneumonia or even death. So therefore, we call this a disease. As Sir said, it's a very it's a disease which we do not know much about. So we need to be very careful with our careful of preventive aspects. Sir has spoken about the social distancing, hand washing, keeping masks, but we should also be talking about the food because if you have low immunity, you can have an increased risk of infection. So low immunity can be due to poor nutrition, and similarly, poor nutrition could also lead to increased risk of infection. Next slide. If you look at the macronutrient deficiencies in India, like chronic energy deficiency, a chronic energy deficiency is usually BMI less than 18.5. I suppose you all know how a BMI is calculated. It is weight in kgs by height in meters square. So you have the formula to enter, and you know anything less than 18.5 indicates you're thin and suffering from chronic energy deficiency. India is still a low middle income country, and more than 20% of Indian men and women have chronic energy deficiency, which means they don't get adequate food to maintain normal BMI, even inadequate energy in this case. On the other hand, we also have overweight and obesity, especially in urban areas due to reduced physical activity. So this is also almost about 20% of the population, both men and women, are either overweight, that is BMI more than 25, or obese, that is BMI more than 30. So this is a challenge we have in India, where we have both spectrum of malnutrition, that is undernutrition on one side, which can lead to poor immunity, overnutrition on the other side, which leads to increased risk of cardiovascular disease. So India as a country are at more risk than any other country in the world because of the dual malnutrition. Next slide. So when we talk about macronutrients are energy and protein, when you talk about micronutrient deficiencies, they're also very important. It's not just energy and protein that determines everything. There are various vitamins and minerals that actually affect our immune status, such as vitamin A, C, D, E. They're all fat soluble. B complex vitamins such as B2, B6, B12. Then we have the folic acid and other minerals such as iron, selenium, and zinc. So we even have micronutrient deficiencies across the country, and one of the major problems we suffer is iron deficiency anemia. So next slide. So if you look at anemia, this is a CNNS data. CNNS stands for a Comprehensive National Nutrition Survey. This was done in 2016 across the country. And based on this data, we could see that almost 40% of children 1 to 4 years, 25%, nearly 25 to 30% of children 5 to 19 years are actually suffering from anemia. And anemia is a risk factor. Those who have anemia have poor immunity. I'll be coming to the discussion a little later. Next slide. So the most common reason for anemia in India is iron deficiency anemia. If you look at the red pie graph, the pie charts, all the three, 53.4%, which indicates iron deficient in 1 to 4 year children, and 30% in 5 to 9 year old children, and 41% adolescent age 10 to 19 years are suffering from iron deficiency anemia, which means that if you are anemic, 50% of the cause is actually iron deficiency, especially it's either could it be in iron diet or through losses. Next slide. Similarly, we have other micronutrient deficiencies in India, like vitamin A deficiency. Vitamin A deficiency, as you know, would severe illness would lead to nutritional blindness, what we call the bitoid spots in the eyes. So this is about 16 to 22% in 1 to 19 years in India, with variations across the country. Then we have the B12 deficiency. When you talk about B12 deficiency, which is only available in animal source foods, is also very high, ranging from 14 to 31% in 1 to 19 year old children. And then we have the vitamin D deficiency, which is also very high, ranging from 14% to 24%. Of course, due to success of salt iodization program, we have the iodized salt. We unfortunately do not have much problem with iodine currently. Next slide. So I just spoke about macronutrient deficiencies and micronutrient deficiencies in India and how important they are and how huge they are. And I would now speak about the overview of immune system. So when you talk about the immune system, you can classify them as innate immune system, the left-sided one, and the acquired or the adaptive immune system. So innate immune system is something which is fundamentally there within you. It is always there, like physical barrier. Your skin itself protects from entering bacteria or viruses into the blood. Similarly, gastrointestinal tract, respiratory tract, they all have epithelial lining, which actually prevents unwanted foreign bacteria or foreign body coming into the body, which can lead to infection. Then we have the defense mechanism like secretions such as mucus, bile, gastric acid, saliva, tears, and sweat. So they also have some properties in actually countering the bacteria or the virus entering into the body. And we then have the general immune responses, such as the inflammation, the complementary response, which we now call the cytokine storm. So this is coronavirus actually is triggering this complement system mechanism, where there's a lot of increased in number of cytokines, exaggerated response leading to death. So but that is also the defense mechanism of the body. On the other hand, we have the adaptive immune system. So adaptive immune system is something which will learn after the initial attack. The innate immune system is the first line of defense. Once it comes, then the B cells, which are mature in bone marrow, contribute to antibodies which bind the bacteria or the virus. And that's the reason we know why vaccines are so important, because these are the these antibodies or even the plasma therapy would actually bind the virus and help destroy the virus. So therefore, B cells are very important. Similarly, T cells, which are CD4 or CD8, these are even more powerful and which contribute to cell-mediated immunity. So both together are very specific to certain pathogens. So they are highly specific to. So you have what you call memory cells. So these are something which keeps the viral protein or the bacterial protein in its memory and can be there for the next 2 to 5 years. Even if suppose you have a coronavirus infection, these antibodies help you to protect from the disease in the next 2 to 5 years as well, because they are always primed up and can reproduce whenever the bacteria again comes or the virus comes into the body. So this is the basic overview of immune system. However, next slide. I just want to show you how these innate and immune system are actually affected by micronutrient deficiencies, because each micronutrient has a role in the innate and the adaptive immunity. You look at vitamin C. So vitamin C is used as to promote collagen synthesis. So collagen is something where it lines various epithelial cells and therefore is a barrier for entry of any cells. It is also a powerful antioxidant. As you see, there are many studies now in China that high dose of vitamin C can help. There is no proven therapy yet, but you are aware that vitamin C is a very powerful antioxidant, and it is a water-soluble antioxidant, which means it is very easily, cheaply available, which is rich in guava, which is rich in citrus fruits. So it's a very powerful vitamin which you can take daily. And it also not only acts on the innate immunity, but also on the acquired immunity. This can increase serum levels of antibodies and has role in the lymphocyte differentiation and proliferation. Vitamin D, as we know, is the sunshine vitamin, is available from the sunlight, and the vitamin D receptors are in the innate immune cells, expressed in innate immune cells such as monocytes, macrophages, and dendritic cells, and helps in the differentiation of these cells. Similarly, it has also on the acquired immunity, so mainly inhibitory effect for adaptive immunity. For example, vitamin D helps suppress antibody production by B cells and inhibits T cell proliferation. So this is how it acts. So it is very specific to each of the T cells here. We also have the vitamin A, which I already spoke about, which is especially important for cornea, but also other cells such as skin cells and the respiratory epithelial cells, which is important to maintain the innate immunity. It also has a role in the T and B lymphocytes. There are also some trials in children which have shown some evidence of reducing mortality with measles infection. Therefore, we always give measles and vitamin A together to improve in case the child has measles later in his life. Next slide. Similarly, we have the vitamin A, which is again a fat-soluble vitamin. So this is also protects the integrity of cell membrane from damage, especially from free radicals. All fat-soluble vitamins are usually present in cell membranes because cell membrane is lipid layer, and fat-soluble vitamins need to have the fatty layer to actually get deposited. Similarly, it also actively plays on adaptive immunity, on enhances T cell mediated function and lymphocyte proliferation. So we have the vitamin B6, again pyridoxine, helps regulate inflammation, has role in cytokine production and natural killer cell activity. And also on the adaptive immunity, similarly like the vitamin D, which I will not repeat it again. B12 also has a role in natural killer cell functions, which is an innate immune marker, and also plays an immunomodulation, especially with effects on cytotoxic cells. Next slide. So we have the folate again, which is also especially seen, the deficiency is very common in adolescent girls and in pregnant women, which could lead to neural tube defects, and is so it also plays a key role in both innate immunity, which maintains innate immunity through natural killer cells, as well as adaptive immunity, especially in cell-mediated immunity, important to raise sufficient antibodies to antigens. Zinc here, when you come to minerals, zinc is a very key element. We have seen many trials which have shown that zinc reduces diarrhea and is a powerful immunomodulator, helps regulate inflammation as well, and has role in cytokine production as well as natural killer cell activity. Coming to adaptive immunity, it has central role in cellular growth and differentiation of immune cells that have a very rapid turnover and differentiation. Iron, which is one of the most commonest deficiency in India, is involved in regulation of cytokine production and action, and also is involved in differentiation and proliferation of T lymphocytes. Copper is a free radical scavenger and has antimicrobial properties, and it accumulates at the sites of inflammation and is important for IL-2 production and response. Similarly, it has also a role on adaptive immunity, has roles in T cell proliferation, and also in antibody production and cellular immunity. So we have selenium as well, which is a trace element, And we know that selenium is especially present in enzymes in selenoproteins, and which acts as redox regulators and as well as antioxidants. And in adaptive immunity, it is especially involved in T lymphocyte proliferation and role in humoral immunity. Next slide. So this is how it is so important that both macro and micronutrient deficiencies, which are very common in India, can lead to poor nutrition. So what happens if you have poor malnutrition? You could see that the first step is not only these micronutrient deficiencies have immunomodulators, they also affect your appetite. So if you have poor nutrition, it will lead to poor, inappropriate, prolonged, reduced immunity, leading to prolonged illness, and also loss of appetite, which is a vicious cycle. So the one leading to other. So which means that the more malnourished you are, the more chance of you getting infected. And again, the more chance of you getting infected, the more chances you getting malnourished. This is called the vicious cycle of malnutrition infection, and especially seen in children. Coming to adults or young adolescents, next slide, where diarrhea is not that common, it is a result of a lot of factors. So especially you could see that poor diet, on the left side, you have poor diet because of either restricted diet. We have food fads, people start, especially in adolescent girls, we stop eating foods. So we especially stop trying to maintain fat diets, and zero, you want to have the zero balanced diet, zero shape size, and especially sedentary lifestyle, such as obesity, as well as fast foods, which are energy dense but micronutrient poor, and also lack of poor low income and lack of fresh nutritious food. All of them are actually resulting in poor diet. Not only poor diet is an important factor, other factors such as cigarette smoking, air pollution, physical and psychological stress as well. So it's very important that during lockdown, that you should not be overboard of the disease. You should actually have a very positive mindset while being in a confined environment as well. Sleep disturbances also lead to compromised immune function. Therefore, you should be very active at your home, and excessive alcohol consumption and prolonged excessive exercise, not only mild, in case of heavy work also, there is a case of compromised immune function with increased risk of infection. Next slide. So to control malnutrition, it is very important to have dietary diversification, which I'll be talking about. What is diversity here? When you talk about energy foods, protein-rich foods, protective foods. So that is one way to do it. There's one thing called food fortification. So food fortification is a method where you add additional nutrients into the food through biofortification, or which is field-based fortification, or through a factory where you actually have fortified micronutrients. There's another way is supplementation, where you have these medicines available outside, where you have various micronutrient supplements such as capsules or tablets or syrups. So all of them can actually help control micronutrient deficiencies. So micronutrients is one part. The other part is also good quality protein, which is available in milk, eggs, and fish. Protein is also very important, and is also a very good immunomodulator. So we should be very careful that depending on our situation, we should be aiming at the increase of intake of micronutrients through various methods. If food diversity is not possible, diversification is not possible, go to food fortification. If food fortification is not possible, go to supplementation. So these are very important. These are the three ways of doing to control malnutrition. Usually food fortification is a middle ground where you can actually, it's a very safer ground, which is much more easier has more compliance than supplementation, but tends to have very less immediate, but its impacts are very short term and not long term. Dietary diversity is always regarded as the most desirable and sustainable option, though it takes the longest to implement because of various reasons. Next slide. So I'll not be going into the slide, but I'll just give you the slides which shows how supplementation can improve micronutrient status and reduce the risk of infection due to improved immunity at various stages of your life, from birth, childhood, adolescence, adult, and older age. I've already spoken to you about various innate and adaptive immunity. So this slide speaks about how these micronutrient supplementation actually have helped. Next slide. So we're talking about, what food should be the right food. So what we call is the balanced diet. So balanced diet is something which includes wholesome and varied diet that includes all the food groups that can enable a good immune function. So these include one, energy-rich foods such as cereals and millets, rice, chapati, jowar, and all the millets, even ragi, fats and oils, such as vegetable oils are also important, and especially DHA. We're doing one study in one of the social hostels, the role of importance of DHA in cognitive function. Sugars, of course, are not that important, but nevertheless are included under energy-rich foods. Next, we have the bodybuilding foods, such as protein-rich foods, such as pulses and legumes, such as dal, what we consume daily, and even the beans. We have eggs, which is a complete protein, flesh foods, especially fish, meat, and red meat, and the chicken. So try to avoid red meat, but not as much as possible. And we have the milk and milk products, which are can be consumed by all groups, including the vegetarians. And then we have the protective foods, the third group, which are the colored fruits and vegetables. So we will be going in one by one into the details. Next slide. So I've already spoken to you that energy-rich foods are to be consumed in moderation. It's very important that you don't undereat or overeat. And so the best way to take your grains is to make half of your grains whole. What I mean by whole is that they should be having enough fiber. So whole here is whole grain cereals. Whole grain cereals include wheat. So, but in Telangana, we eat rice. Rice is not a whole grain. So if you're consuming rice throughout the day, so which is actually not good. So we should be trying to make those make some portion of rice replaced by either millets or wheat. Wheat is like you can make chapatis or like pulkas, which could be taken. So this is important that don't eat rice throughout the day and make sure half of your grains whole. This is the first point you have to remember, because they not only provide fiber, which can help maintain your glucose homeostasis, but also provide important micronutrients, because millets are very rich, are also called nutraceuticals, because they are rich in various micronutrients and minerals such as vitamin A, zinc, iron, calcium, especially ragi. So they're very good in micronutrients and help in improving gut microbiota as well and immunity. So gut microbiota is also very important in the context, as you already have done one study at your one of the social hostels looking at this gut microbiota, and I've already described to the school children how gut microbiota plays such a huge role, and why the already we have given you one millet snack for this reason, especially so that it can improve your gut microbiota as well as immunity. Of course, when coming to oils, so there are different kinds of oils available in the market. So it is best to use a blend of oils, not one single oil, because sunflower oil, for example, is rich in polyunsaturated fatty acids, which is PUFA. So too much PUFA is also bad. So it's very, very important not to take sunflower oil every day. Rice bran oil, olive oil are also rich in omega-3 fatty acids, and groundnut oil is rich in MUFA, which is monounsaturated fatty acids. So it's especially important that you keep changing oils. So oils are those which are liquid at room temperature. That's a very fundamental fact what an oil is. So we should be taking them. We should be consuming liquid oils as much as possible and avoid solid fats such as butter, cheese, and ghee, because solid fats are high in saturated fats, and this increase the risk of comorbidities such as cardiovascular disease, and therefore we need to avoid them. Next slide. So when we come to protein-rich foods, so protein-rich foods are bodybuilding foods. I've already told you that, such as pulses, such as dal, green gram dal, which provide good source of protein and are to be consumed adequately. So when you take pulses and cereals together, they can reach protein requirements to a great extent, because cereals are deficient in one amino acid, lysine, and pulses are deficient in one amino acid, methionine. So what I usually remember is CL and PM. Prime Minister has taken one casual leave. That's how I usually remember. It is PM and CL mnemonic. So pulses are deficient in methionine. Cereals are deficient in lysine. So it is very important that we combine them together. It is recommended to have a combination of 2:1 ratio parts, but it's 2 parts of cereal to 1 part of pulses to ensure that you have enough protein in your diet. Pulses are also rich in various B complex vitamins such as thiamine and riboflavin. So B complex vitamins are those. So these are the vitamins that get very depleted very quickly because they cannot be stored in the body. Unlike fat soluble vitamins, they can be stored in some fat in your body. But B complex are being water soluble, they'll be in circulation always and be excreted in urine for a prolonged period of time. So they cannot be stored long periods. So even if you are, so suppose you are starving for a week, for some reason you have been in lockdown and have no accessibility to food, the first thing the body will adapt is to try to lose fat and energy as well as the B complex vitamins. So it's always, so therefore we always see B complex deficiencies in refugee camps where they have access to food. So this is very common. So therefore B complex vitamins are to be given where there is shortage of food. So it's very important. So there is one advantage of taking these foods because they are non-perishable. Now people are recommending not to go to outside, unless it is necessary. So unless it is necessary, you go outside. So if you buy things such as cereals and pulses for at least 2 weeks, so there is no need for you to go out, and they are non-perishable items and they can be safely stayed for at least more than 2 weeks. So only when necessary, you can go out. So try to make sure that you consume them in adequate quantities. Next slide. Next slide. So you can, when you talk about other protein-rich foods such as milk is very important, but make sure that you take low-fat milk and not a high-fat milk. The milk which we consume using Vijaya dairies, it is only 3% fat. It is a low-fat milk, so not a problem with it. Take milk because it is not only rich in protein but also provides calcium and is a good source of calcium. So make sure that you have enough milk. And in Telangana, milk for some reason we have a very poor habit of consuming milk and milk products, but ensure that milk has a good source of calcium and is useful for strong bones. And it's very important to avoid red meat. So red meat is anything which is mammalian meat. So mammals have red meat. For example, lamb produces mutton, cow produces beef. So both are both are from mammalian meat. So avoid anything that is red meat because they are high in saturated fat and is an increased risk of cardiovascular disease. Instead, replace with fish. Fish is a very good source of protein as well as DHA, and also take lean meat such as chicken. So chicken is not that rich in saturated fat, so it's best to take chicken instead of mutton. So also eggs is complete protein. So the biological value, so this is a reference protein and provides the highest quality protein and also rich in other nutrients and usually provided in many programs. So we have the ICDS programs. So eggs are also, though they are not as perishable as milk and milk products. So you can give eggs as a take-home ration for 15 days, and then you can use them for at least 15 days easily. That's what ICDS centers give. Not only they give rice and pulses, they also give eggs for 15 days monthly. Next slide. So there's a lot of concerns that chicken or egg because of swine flu. Earlier swine flu was because of chicken, and therefore they had even coronavirus. So they thought because it was coming from bats or coming from snakes or other animals, they thought that it could come from chicken also. So there was initially a lot of scarcity, but you could see there's a lot of ads. Even the chief ministers, all the ministers, the Department of Health, saying that there is no evidence to show that consumption of flesh foods can actually lead to increased risk of infection. So do not worry about it. So chicken and eggs are very safe. However, it's very important that they're cleaned and cooked properly because of other bacterial sources and especially contamination. So you should also be very careful when using flesh foods. They have to be cleaned properly and also cooked properly so that they are digestible. So now we talk about the third food group, which is the protective foods. So protective foods are fruits and vegetables. So when I said cereals to be consumed moderately, fruits and vegetables are to be consumed liberally, which means as much as you can, especially the colored fruits and vegetables, because they're rich in fiber, they're rich in antioxidants, they're rich in minerals and various vitamins that help in improving immunity. So when you talk about colored vegetables, you can talk about the dark green leaf vegetables such as amaranth leaves, spinach, the palak, the fenugreek leaves, which are rich in vitamin A, iron, and calcium. So all green leafy vegetables are rich source of vitamin A, beta carotene, iron, calcium. So they're very rich sources. Therefore, consume them in good quantities. I'm telling you how much in the next slide. The next is the yellow colored foods such as carrot, which is vitamin A, beta carotene. Papaya is also rich in beta carotene. Mango is rich of vitamin A. Orange, lemon. So they're also not. The lemon is quite cheap. They're not so costly and a very rich source of vitamin C and vitamin A, and also natural antioxidants in the diet. So lemon juices are very available around the year. So you can always have lemon, especially vitamin C also improves iron absorption. It's very important for you to remember that vitamin C improves iron absorption by almost 5 times. So it's such a hugely powerful iron promoter. So even always take vitamin C rich foods with a meal, especially if you are anemic. That will easily improve your iron in the diet as well as in your body. Next slide. So how much to consume? What we call the hand formula 5. When you talk, your hand has 5 fingers. So it is 5 servings of fruits and vegetables each day. So what is one serving? A serving is about 80 grams of any food and vegetable. Such as example, one banana is 80 grams roughly. One apple is about 80 grams. One orange is around 80 grams. So, or else you can take it as 1 cup of green leafy vegetables. So 1 cup is usually 250 ml. This is a standard cup used in nutrition dietitian's measurement. So always remember 1 cup here is 250 ml of green leaf vegetables. You chop them, or half cup of other fruits and vegetables. So sometimes it's very easy because green leaf vegetables have a lot of air space. Therefore, you say 1 cup. For other fruits and vegetables, they are a little heavy also. So therefore, half a cup of fruits and vegetables. So that's how you remember. So always, whenever you consume at least half a cup of fruits and vegetables or 1 cup of green leaf vegetables at least 5 times a day. So when I say at least 5 times a day, it could be more. It could be 6, it could be 7, it could be 8, 9. The more the Mediterranean diet recommends 7 to 9 servings a day. So the more you consume, the rich source of polyphenols, which are also reduce the risk of chronic diseases. So therefore, take them liberally. The other group is also important productive foods is nuts and oil seeds, such as groundnuts, which are rich in various vitamins and minerals, mustard seeds, gingerly seeds, flax seeds, almonds, which are little costly, walnuts are also costly, but they are rich source of polyphenols and many minerals that improve immunity. So when you talk about groundnuts, how much to consume a day? So this is a very simple nutrition formula where take them in your hand and make it in a fist. How much your hand can make a fist of nuts? So it's called a fistful of nuts. So that's it. You take a fistful of nuts. So everything is in your hand. Productive foods is in your hand. Take 5 servings of fruits and vegetable and take a fistful of nuts each day. Next slide. So when you talk about water and electrolytes, it's very important to talk about sodium and potassium. So limit salt intake daily to less than 5 grams per day. So 1 teaspoon. So 5 grams is 1 teaspoon. So not more than 5 grams of additional salt intake every day. Keep yourself hydrated, especially if you may wear facial mask, surgical mask. If you're not hydrated, they can easily make permanent marks on your face. So you should always make sure that your face is hydrated, because when you wear mask, there's not enough. So there's a lot of suffocation that happens. So make sure yourself to be hydrated. So make sure that you drink at least 8 to 10 glasses of water, preferably warm water, because of COVID-19, and any fluids. It could be lemon juice, tea and coffee very occasionally. I would not recommend tea and coffee, especially 1 to 2 hours before and after the meal every day. So be careful not to consume, especially caffeine, such as tea and coffee. Not too much caffeine. 1 cup is not too much caffeine, and avoid sweetened fruit juices. So too much of sweet again increases the risk of hyperglycemia. Syrups such as corn syrups, they also increase the risk of hyperglycemia. Fruit concentrates and even fizzy and still drinks such as Coca-Cola, which has added sugar. You might remember that 1 Coca-Cola has almost 5 teaspoons of sugar. So remember, when you're drinking Coca-Cola, 350 ml Coke, you should always remember that contains 5 teaspoons of sugar. So even your tea does not have that much. So it's a very high concentrate of sugar. Therefore, avoid it, and make sure that the consumption of clean foods and practice safe handling of food, as already told by Dr. Santosh before. Next slide. So when you talk about the frequency of meals and snacks, it is always advisable to consume small frequent meals daily, because it maintains your normal blood glucose levels and which reduces risk of diabetes. So take small frequent meals and snacks. That's what we recommend. And for snacks, choose raw fruits or fresh fruits or even the nuts or home cooked snacks. And and try to avoid foods, snacks that are high in fat, salt or sugar, which is called HFSS, high fat, high salt sugars, foods such as chips, which are rich in very high fat content, ice creams, sugar sweetened beverages. Of course, samosas made at home can be fine, but patties are very rich source of fat, so try to avoid them because they can increase the risk of obesity. Next slide. So diet is one important aspect. The other aspect is physical activity. So it's very important for maintaining body weight. So one is consumption, that is energy intake. The other is energy expenditure, and what the body weight is dependent on both of them. The more you expend your energy, the better your body, your fitness status. It is also good for bone, muscle, and heart and lung. So always, so make sure that you have adequate physical activity. If you're not able to do outside physical activity because of lockdown or other things, you can also do indoor physical activity, especially yoga. You could do aerobics. You could do dancing. You can have. So there, of course, whenever I come to hostel, you always have some dancing practices, which is good for you. At your hostels, I hope they resume as soon as possible for you. But so this is how you can maintain indoor physical activity. So it is recommended that you have at least 30 minutes of physical activity of at least 5 days a week for adults, and 1 hour, that is 60 minutes for children. So it's very important for children, it is 60 minutes. For adults, it is 30 minutes. So make sure that you have enough physical activity. Next slide. So when I talked about body weight before, I told you that chronic energy deficiency is anything BMI is less than 18.5 kg per meter square. So you should always have better than that, and you should not go beyond 25 kg per meter square because that leads to overweight and obesity. So that is the ideal body weight. And so how do you calculate ideal body weight? Take your weight in kgs and then divide it by height in meter square. So if your height is 5 feet, which means it is 1.150 centimeters or 1.5 meters. So if weight is 50 kgs, you will divide it by 50 by 1.5 into 1.5. So that is how you calculate the BMI. So then then it should be between 18.5 to 25. Make sure that you have this BMI within this range. Also, exposure to sunlight is very important. Even if you are at home, make sure that you come to the windows at noon time, because it is very important that you open your doors during noon time, because sunlight also kills the virus. There is some evidence to show that sunlight and hot temperature above 30 degrees has an effect on coronavirus. So make sure that you have enough sunlight exposure. And the other thing is also maintain regular sleeping pattern, so that you have to ensure the circadian rhythm is not disturbed, especially during lockdown. You might be working in the night, or you might be watching movies in the night. Sometimes you might not know what is the time is. So it's very important that you have a proper sleep, at least 8 hours a day, to maintain good immunity. Next. So finally, I would say that both undernutrition and overnutrition can increase the risk of severe TB infection. So low BMI or high BMI is dangerous. It increases the risk of infection, hospitalization, and mortality. So make sure that we are properly nourished using a balanced diet along with physical activity. So these together are the cornerstone of good health. So I've already spoken to you what is balanced diet. It includes energy foods, energy-rich foods, protein-rich foods, bodybuilding foods, and the protective foods, that is the fruits, vegetables, and nuts. So take them adequately, and where fresh foods are not available or not possible to consume, you could use fortified foods. So fortification is one way, especially double fortified salt is available. So we have already given pearl millet chickpeas, which is rich in iron, zinc. So there are various fortified foods, biofortified foods that are available. So you can use them. With this, I conclude, and thank you all for patient listening. Yes. Anna?
Hello, madam. Madam.
Right.
Hello.
Thank you, sir.
Madam, is there any questions to Dr. Rajesh Ishwan? In spite of his busy schedule, he is with us. Hello, madam.
Hello, sir. Good morning.
Yes, yes.
Yeah, good morning. Yeah, this is Dr. Pavani, zoology lecturer from Mahindra Hills. I have a
Yes.
small doubt. You said that we have to take a handful of nuts every day
Yes.
for good health. So, but my dad, like, or most of the patients who have cholesterol issues,
Yeah.
what should be their consumption regarding these nuts and oily foods?
Yeah. So when you talk about so cholesterol it's very important to note that cholesterol is only available in animal source foods, especially eggs and meat. So cholesterol is not available in plant source foods. So it is useful. So you should always that nuts are rich in MOFA. So groundnuts are rich in monounsaturated fatty acids, minerals. So they can a fistful can be consumed, not too much. Again, as I told you, not too much, but they are good in various polyphenols, not just groundnuts, cashew nuts. Then none of the nuts are a source of cholesterol because they are of vegetarian origin. Cholesterol is only available only present in animal source foods.
Sir, so consuming nuts, will it increase the triglyceride level? Will it affect?
Yeah, so triglycerides. So as such, so when I talk about 50 grams of nuts, that will not elevate the triglycerides because that is a part of balanced diet. So nuts is a healthy option and are rich in various minerals, so it does not increase triglycerides. Yes.
Okay, thank you so much, sir. And I have one more query. Again, for patients with high triglyceride levels, usually they suggest eating only egg white, leaving the yolk. But
Yes.
yolk is also equally nutritious, right? So could you please comment upon like who can take or consume egg yolk and who can consume egg white? Can you
Yeah.
please explain that?
Yeah. So here you should understand that if triglycerides. So again, cholesterol is so 1 egg per day is usually fine, recommended if you're unless you're a heart patient. So if you're if you have high triglycerides, and especially 1 egg, what happens is cholesterol is also synthesized in the body. So the amount of cholesterol synthesized in the body per day is 2000 milligrams. So it's very high, 2000 milligrams compared to the cholesterol in egg is 400 milligrams. So if you have high cholesterol in the diet, that usually compensates in it. So unless you have a severe, very high levels of triglycerides, or also risk of what we call ischemic heart disease, like heart a person who has stent. So there is a different recommendation is different. We are only advise 2 egg yolks per week. So even they are advised 2 egg yolks per week. So it is not that it is to be completely avoided, but ensure that 2 eggs per week is usually recommended. So not daily, but 2 eggs is enough.
So people who belong to our age group, like 30s, 30s and 40s, who don't have any complications, can happily consume like a whole boiled egg every day. No
Yeah, you
problem
can.
if we can take the yolk also.
Yes, no problem, no problem, no problem.
Okay, thank you, sir.
Any other question?
Any
Madam?
other responses? Any other queries? Anybody who want to speak can unmute yourself and ask any question. Otherwise, you can also send your, as I told earlier, you can also send your queries to forms and all, which will be available shortly.
Hello, sir.
Yeah.
There is someone in the audience who has asked you a question. She's Pravalika, our student. She's saying that we take nuts in the form of overnight soaked nuts, for example, groundnuts, almonds, and walnuts. By this, nutrients are also increased or synthesized upon soaking. Is that true? She's asking. Do we have to soak the nuts before we consume them? Is it better to consume them like that? That is.
So when you talk about soaking, you talk about sprouts. So when you talk about soaking, so usually we don't ask people to soak nuts, but we ask them to sprout nuts. Sprouting actually helps in producing B complex vitamins. Soaking here does not lead to any particular advantage because of the fat lipid layer outside. So because cashew nuts are have fat, water does not penetrate inside and does not do much benefit to it. I would suggest to soak sprouts. Sprouting
What
would
about
actually help.
almonds, sir? Because they always recommend to they always recommend to soak almonds overnight before consuming them. So it does not have any effect on them, like additional nutritional benefit. Soak the almonds over raw almonds.
Yeah, so maybe I'll come back to you on that question because I'm little less aware, so that I'll not be taking it overboard. As far as I'm concerned, no, I've not seen studies saying that soaked almonds are a little better. But nevertheless, I'll come back to you on that, and I'll answer your student through Dr. Devraj sir shortly.
And our next speaker is Ayurveda physician. Ayurveda physician always advise this: you soak in water and then take a morning. So he will give you the better answer.
Yes, yes.
So keep watching, keep
yes.
asking.
I hope the next speaker would answer the question for you. Any other questions?
Hello. Hello.
Hello.
Madam. So can we end?
Thank you, sir. Once again, thank you, sir. Thank you, Raja Sriswan Vamedi, sir, for giving a very nice session of nutrition aspects to COVID and all. It was very informative. All of us were really got a good aspect of how to have nutrition in this particular period. Really, thank you so much. Right, sir. Thank you, sir. And any other queries, we'll be sending it to you. You can also answer it to us, sir. Thank you.
Madam, can we go for next speaker?
Yes, sir.
Select the Madam, you can announce some announcements over here.
Yes, sir.
If you have any announcement, you can make announcement.
Okay, right. So all of the participants who are there here, I again want to tell you that you will all get the participation certificates only when you are going to fill up the forms. So kindly see to it that you're all entering into it, and then afterwards all the queries, whatever you have to have, you can have it later on also. So see to it that you are interacting with the doctors and scientists and all in a proper manner.
Once again, I welcome you all. Dr. Saket Ram is on board now. He's a Ayurveda physician, very matured scientist come physician. He's from National Institute of Indian Medical Heritage. It's a CCRAS institute at Hyderabad. So he will talk on Ayurveda perspective on COVID-19. Dr. Saket Ram, please.
Yeah. Thank you, Devraj sir, and my sincere thanks to all authorities and principal madam and all the dear students of Social Welfare Degree College. Namaste to all. Am I audible? Am I audible, sir?
Yes, sir. Yes, sir.
Now I would like to share my slides. Just give me a second.
Madam.
Can you all see my slides?
Yes, sir.
The slides are visible, right? Yeah.
Yes, sir.
Yeah. After 2 wonderful sessions, now I think it was a wonderful session by Mr. Santosh and followed by the nutrition nuances. And now it's my turn to take you to a little more pragmatic world, the world which we are all already familiar with. So to begin with, I would like to just say a few words about Ayurveda. Ayurveda, don't look at it as a separate alien thing. It is not a separate thing. It is a part of our lives. We are born with the Ayurveda wisdom, and India is the originator of this particular great wisdom of more than almost 3,000 to 4,000 year old continuity. And just to briefly introduce you, Ayu means it is the lifespan. Ayu, whichever is passing by, is Ayu. And you know, all the biological organisms have a certain lifespan, and humans, nevertheless, we have around 100 years of lifespan. We all know about that. And Ayurveda is especially, it's a sort of exclusive Indian branch which deals with humans, animals, as well as plants with respect to mostly with the aspect of health aspect. And also it encompasses and it visualizes human being as a part of this whole universe. And the mutual dynamics are very well considered whenever anything related to health is discussed. And I would like also to tell you that though it's very ancient, it is quite modern in its approach. When I say modern in approach, because we are all school going, we are all taught in the schools and all, we have certain way of understanding things now. Ayurveda was also a very strict discipline, which needed a lot of understanding of different kinds of like logical systems, and also very astute observation capacity to, first of all, to initiate into the study itself. And we Indians are really blessed with very good abilities of analogy and also logic at the same time, where people give to people basically. Of course, due to many invasions and all, due to a lot of imperialism and continuous backlash on our psychology, we tend to think in a sort of inferior way to the West, but which is absolutely wrong. In fact, West is now looking towards East, mostly towards India and other aspects, for now really understanding the complicated issues. For example, now COVID is one such scenario where seriously it has put everyone into the dizzy, and we're all like groping in the dark what to do next. And why Ayurveda is important for us? Ayurveda basically said it is adhered to the nature. It talks the human life in tune with our day-to-day routine. From morning to evening, we have a nocturnal and diurnal cycle, and as any other organism, we also tend to have certain mood changes, and our appetite keeps changing. At a certain time, you feel sleepy. At a certain time, you are very awake and active. This is an everyday, day-to-day experience of all of us, and the very basic tenets of Ayurveda are based on this. So you have to behave in certain way at a certain point of the time, so that your overall health is protected and you are not becoming susceptible for any external attacks by like microorganisms or whatever. So basically, its basic approach is very much close to the nature and based on the astute observations, the patterns. So now we all know the circadian rhythm and all these are all experimentally proven, and the Nobel award, Nobel Prize is also given for discovering the circadian rhythms. Basically, this understanding is innate and we all know very well, but because of so much of externalization and outsourcing of our thoughts to the we always expect that somebody has to teach us. We have almost stopped being relying on our natural instincts, unfortunately, due to this huge urbanization and in a way too much of education is also in a way certain blunting our instincts. So basically, Ayurvedic approach is based on the human instincts, our original animal instincts, and also it also considers our higher human consciousness, our intelligence. So it's a combination, powerful combination of understanding self more and more and relying on our self intelligence to really stay in harmony with the external environment. Or if some attacks, something like this COVID attacks, something comes from external, how to handle it. And another best example of how Ayurveda practices. So again, this is another best example of Ritucharya. In India, you see, this is a beautiful place. Indian subcontinent, unlike other places in the world, is a very unique place. We have roughly 6 seasons. 6 seasons very clearly happening every year, unless there is a natural calamity or a big drought or a famine or a very serious flood-like situation. Otherwise, in most of the parts of the country, we all know that there are these 6 seasons. Like winter will be followed by the spring, then followed by the summer followed by rainy season. Again, the Shishir Ritu, there's a pause of little pause between the winter and the rainy season, like Dasara period and all. And if you remember, in Indian culture, we have a lot of festivals, and each festival falls in certain season. And that particular festival has certain particular type of food items and particular rituals to assign to it. All that is actually in sync with this particular seasonal routine. And we know these kind of viral infections and all are definitely susceptibility of to this kind of infections is more in certain seasons than compared to other seasons. Of course, COVID-19 is a very exceptional condition. Now we are trying to understand in this problem. But if we see the kind of death toll which happened in Italy or say USA, that initial peak period, it was so frightening. The reason is that is the season of mostly that's the season when a lot of this crop and allergy-like conditions are more in that particular part of the world. And that has added to the problem, and lack of understanding of the problem, lack of social distancing initially, and a lot of infected people getting into those countries. combined all together, and also the age factor and many things had led to such a catastrophic death rate in those countries, which per se, luckily, because of the great measures taken by our government, state government and central governments, somehow, I mean, it's a miracle actually that probably we have missed that nonsense, and now we are all prepared, and we'll be definitely able to handle this problem in a very, very nice manner. And now, not getting much into other aspects, I would like to straight away come to the COVID situation and what Ministry of Ayush, Government of India, in tandem with Ministry of Health and Family Welfare and FASI and all, it has given us some simple guidelines. I'm specifying on the aspect why I'm calling it simple. Simple here means which are practicable in day-to-day life. And you know, we have different people, different socio-economic conditions, and different cultural backgrounds. And as the earlier speakers have pointed out, we are all put to a containment zone. We are all in a sort of captive situation now. So we have to think about solutions which are simple, but at the same time which are very effective also. For example, we switching to the fabric masks was a big paradigm shift when PM has called to everybody to help themselves by stitching their own masks and wearing them in a proper manner, as Dr. Santosh has described. So that was a big leap of faith. And at the same time, if you see socially, they are helping us, making us self-reliant. Instead of really looking that the government should come and provide, there should be supply of masks and all. So we could circumvent this problem, and we could actually now become self-reliant. For example, now in India, in most of the places, we do see people, I mean, from very lower economic strata to people who are able to afford, all of them are having these masks. And to a certain extent, we all got sensitized. So these guidelines are also in the same line. These are simple but effective guidelines, and they're all very easy to practice. So I'm starting with the simple warm water. So in this kind of practices, I'd like to request one thing. See, as this is a new situation, we have to use methods which are time tested. Of course, some things may not be really backed by the laboratory data, but that will follow. The lack of laboratory data does not mean that we should not employ the things which are available for us for quite a long time, which have proven very effective. For example, I was reading a news item some time back. For example, you take Kerala. Kerala is a place of Ayurveda. Everybody are aware of it. Every householder there commonly employs this day-to-day regime and all. They are all used to it from quite a number of time. They are having good habits of they walk a lot, and they are early risers, and they take food, timely food and all. So there it seems the infection rate has been contained, and one factor which is being attributed and studied is that the healthy Ayurveda practices which are already in vogue. And in other parts of the country also, probably something beautiful is happening in this particular direction. So here, the first direction is very simple: drink warm water throughout the day. That is very, very handy. What happens, as Dr. Santosh has pointed out, so maybe that hotness will, to certain extent, help clear the throat and all. There will not be any clogging of the phlegm and all. And that automatically, and you are very alert when you are drinking. You are very mindful when you can't just simply gulp the hot water like warm water. So sorry, like cold water. When you take warm water, you are very mindful and you know what you are doing. You patiently take the water, and that's a very good habit. And this is good that we should sustain with this particular habit, unless you have the mouth ulcers, or you have any ulcer-like problem, or some people do not tolerate heat. Keeping them apart, others they can happily go with this particular routine. And you see, the daily practice of yogasana, pranayama, meditation for at least 30 minutes, as advised by Ministry of Ayush, is very good. And the last advice in this is the use of haldi, jeera, jilakara, dhania, and garlic as part of the diet. We all do that. We have to continue using that. And in the next slide, I will the same slide I made in Telugu also for the benefit of wider audience. So I'll just pause a second here for the benefit of all the viewers. So we have again gorvechini itle tagali mano. That is good, unless there is a some health issue, and it's better stick to yoga, pranayamam cheyali. And వంటకాల్లో పసుపు, జీలకర్ర, ధనియాలు, వెల్లుల్లి మొదటి వాటిని మనం యూజ్ చేయాలి. And for immunity promotion, they have advised the use of Chyawanprash. If you are a diabetic, we should better use the sugar-free Chyawanprash. Chyawanprash is a combination. It is prepared by the amalaki, that is usirikaya. So usirikaya, it's very rich source of vitamin C. This is one of the nature's gift to India, and we have been using it from. I should tell you, you'll be surprised. From more than 6,000 years, we are using it in archaeological excavations and all. In paleobotany and archaeobotany, these things, these seeds are found from quite a long period. We should really appreciate our wisdom of our ancestors. So this is quite handy and available even today also. Even if somebody who is not able to like use Chyawanprash, they can use the powder of amla with water or with little mix of sugar and all. Even that also will be very helpful. And of course, this herbal tea nowadays, I mean, from quite some time, like maybe say last 5 or 10 years, even the corporate companies are marketing on this herbal tea like tag. Now, I think now it has almost sort of become mandatory for us. So it is better used. These are all the spices which are available. Every household mostly will have tulsi or say sweet basil, that will be there. Dalchini will be there. Black pepper, miryalu, that will be there. Shunti. So we can mix and like exactly prepare like tea, boil water and then add them, allow them to boil for a little while, then decant them, filter them and add a little jaggery, and if you wish you can add a little lemon also, and it can be taken like from time to time. Instead of taking like caffeine, as Santosh and others have pointed out, instead of going for most of the caffeine and other things, we can use this. This is a very good alternative. And the third one is very interesting. Turmeric is a very rich antioxidant, but unfortunately, the curcumin, which is really well studied. The NIN is the pioneering institute in the world, which has done a lot of studies of good effects of haldi. But what happens is curcumin is not a water soluble thing, so it always has to be mixed with some sort of fat soluble thing. So milk is a good idea. Milk has fats, and it will like mix with that very well. And the good effect of the curcumin will come handy, and this will really help us fight with this corona problem. And not only corona, it helps in fighting with other kind of immunocompromised situations also. So again, the same slide is made in Telugu for the benefit of our audience. So I'll pause a while here so that you can go through this. And here, this aspect of taking this kismis, endu draksha తినడం చాలా మంచిది. So again, for the same reasons, it has micronutrients as well as it has got these reducing sugars. Your mind becomes like your mood becomes better, and it has also good amount of vitamins. So this is also good idea because it's very handy. You can carry even if you are traveling. You can just pick up 2 fruits and you can chew them. And apart from this, if people, of course, this particular suggestion is meant for relatively younger people, in the sense who can understand and the whole concept very well. So you can take a little bit of oil, sesame oil, that is nuvula nune, or coconut oil, kobbar nune, or little ghee, and just put inside the nostril. But there is a word of caution here. If you are already suffering with some congestion or allergy, those persons it is not indicated. It is generally indicated for apparently healthy individuals. To some extent, what happens is when we are doing this kind of treatments, you should understand that we are trying to change the pH levels in the nose actually. So whenever the pH levels tend towards become more alkaline, so there is more tendency of acquiring any infection or allergy. And if it is on acidic side, that will offer the natural protection. And all the vegetable oils and the fat products are having this acidity rising property. So that is the logic actually. But anyway, I want to repeat again with a word of caution. Only people who are not having any nasal infections or any serious problems should try this. This is not per se for everybody. And the second one is relatively simple. You have to take a little 1 spoon of either sesame oil, nuvula nune, or coconut oil, and just swish it for 2-3 times, then spit it out, and then rinse the mouth with warm water. Again, this is also like it will have a little coating in the oral mucosa, and so that has a possibility of containing any infections. Again, the same slide in Telugu for benefit of wider audience. Yeah, this is the last set of guidelines we have. So if you have dry cough and all, what to do? I mean, we really did not run to a shop and buy the cough syrup. In home also you can manage. So steam inhalation is the best idea. So whether you add pudina or not is not a problem. If you add, it's okay. Otherwise, also plain water steam inhalation is always a very good remedy to initially contain dry cough. So this will also increase the like temperature inside the nasal cavity and all, and it will basically allow to clear the passages. And they are all very good. If you do once or twice a day, or if you go out and come back, if you feel any kind of irritation, you can try this. And of course, you can add little lavangam mixed with the natural sugar, that is jaggery, or little with honey. If you chew together, the throat irritation will come down. So, but anyway, the most important thing is, as everybody has pointed out, this is a very tricky situation, and we have not yet understood this particular problem. So, if there is any problem, if you have repeated sneezings and any condition is there, it is better get evaluated than simply keep trying any household remedy and finally land in any problem. So that is also very important. These are all meant to like be watchful and very mindful. That is the basic idea of all these guidelines. And I also have collected few resources for you. For example, this first one, if you want to practice yoga at home, now you see 21st of June, day after tomorrow, we have International Day of Yoga. This particular link, I will just show you this. You can see the slide change. Anybody can confirm? Hello.
Yes, sir.
Yeah. So this is a protocol which is available about yoga practice. A complete 20 to 30-minute protocol is available.
योग आवश्यक रूप से एक आध्यात्मिक अनुशासन है जो विशेषतः परिष्कृत विज्ञान पर आधारित है। यह स्वस्थ जीवन के लिए एक कला और विज्ञान है। योग शब्द की उत्पत्ति संस्कृत दाहिनी और बाहिनी ओर घुमाना के संकुलन को ठीक करने में। पुनः वज्रासन में बैठ जाएं। हथेली को बाएं घुटने पर ज्ञान मुद्रा में रखें। दायां हाथ नासाग्र मुद्रा में होना चाहिए। दाएं अंगूठे को दाहिने नासिका छिद्र पर रखें। बाएं नासिका छिद्र से श्वास।
अज्ञान केंद्रित जीवन के स्थान पर
शांति।
Yeah, can you see my slides now? Hello.
Yes, sir.
Yeah.
Yes, sir.
So this particular link we will share. So probably you go on YouTube, you can type yoga protocol, you will get it. And second is a very important link which talks about all the guidelines which I have discussed. And this third one is very, very recent. That is Eat Right by FSSAI, or Food Safety Organization. This is a very important source of information, and all the information given by NIN, I think it's also incorporated in this particular book. You can also see this book. I will just show you the link and the book for you. Yeah, this is the book which talks about what to consume and how to consume. So these three things, you please use them for your benefit and also disseminate among our colleagues and students. And apart from this, if you want to see what's happening in terms of research and development in terms of Ayurveda, so from our institute, we run a portal, Ayush Research Portal. There we have created a unique, exclusive dashboard, National Repository on Ayush COVID-19 clinical trials and other R&D initiatives from Ayush. So the link is available here. You can also go and visit this. So a lot of trials are being attempted based on Ayurveda medication and also the regimes also. Hopefully, we'll be able to come up with good solutions for the benefit of the entire mankind. And apart from this, because we are dealing with degree students here, so there is a new concept called Ayurveda biology. Especially, you see, Ayurveda is basically taught as a medical science in India as of now. Degree called BAMS, Bachelor of Ayurvedic Medicine and Surgery. That is basically to train the people as the physicians. But now there is also a very quickly emerging new discipline that is called Ayurveda biology, where the science background students are encouraged to go for PG and PhD studies based on Ayurveda studies as well as the modern studies. So in anticipation that we will understand this science better and we'll be able to harness and develop good treatments from India. Like Chinese have benefited a lot with this aspect. For example, if you see artemisinin and all, they have been picked up from the traditional medicine, and now we see the Nobel Award, Nobel Prize also is given to a traditional medicine scientist there sometime back. But in India, probably due to various reasons, that never happened. But now, from last 15 years, all the governments, all the preceding governments, including the current government, have understood the importance of it, and now they are encouraging in a very big way. So Ayurveda biology is another discipline where if our students, the science stream students, if they want to pursue their career, is a new opening. So that's the reason I want to introduce. And my colleague, Dr. Devraj, he's one of the members from NIN who has been gone through this kind of a training in Pune, Irisha. So Sir will share his experiences later. So this is now we are now able to understand the potential of Ayurveda and other indigenous systems like Siddha and Unani. And now we should harness the benefit of it. For example, in the earlier days of this particular pandemic, entire Ayush fraternity was almost sort of kept aside, unfortunately. But over a period of time, the authorities, the Prime Minister, everybody have again they understood, and now they made us a part of this mainstream exercise. Now, in many places in the country, like in the states like Kerala and even in Andhra Pradesh, Telangana state also, the Ayush is contributing in hand with our allopathy modern colleagues. For example, the Regada Hospital, Ayurveda Hospital is a quarantine center from the beginning, and the Naturopathy Hospital is also quarantine center. And a lot of Ayush Raksha kits are being distributed to police personnel and also frontline workers in anticipation that the immunity is built up in them and they are protected. So now it has become a full circle. Now it is time for all of us to get together, the science stream, the modern medical facilities and Ayurveda and all kind of things. We should come and bring in our synergies and fight with this particular problem. It is not just with individual care. It has to do with more of our community conscience and also a collective conscience now to bring in all our energies, the synergy, and to bring out the best out of what can we do indigenously. So now that is a challenge. So these are a few other institutes where now the Ayurveda biology is one of the important courses. For example, the University of Transdisciplinary Health Sciences and Technology, Bangalore, they have this Ayurveda biology life sciences MSc program. And in JNU, the Sanskrit Jawaharlal Nehru University, Delhi, in the Sanskrit Studies department, now they have started this Ayurveda biology program with the help of Principal Scientific Advisor to PM funds and also in collaboration with Ministry of Ayush. So these are all the new vistas. Now, as everybody are identifying, now we are in a new normal now. So now it is time to understand our strengths and weaknesses very well, and we have to complement all of our resources, pool together, and bring best from us. So we should not rubbish anything just by saying that it needs, in the want of the proof, we cannot ignore the best wisdom we were having, our ancestors were having. So the epidemics and pandemics are not new to India. The famines are not new to India. But still, and you see the attacks from many people, a lot of political upheavals India has seen. But still we have survived because we have this innate capacity to come up with indigenous solutions very, very intelligently. So we should now stop aping West blindly. Not necessary. We have enough wisdom within the country. For example, now you see within 1.5 month span, from March to like April, mid-April, we could really empower all of our laboratories, and our all the whole country could be covered with all the testing facilities and all. And now we are almost self-sufficient. So that's the beauty of this country. So this is the best time to evoke our conscience. And before I wind up, there is a app called Ayush Sanjeevani app on the Google Play Store. If you type Ayush Sanjeevani, you will get it. All these guidelines are available in that. Use them, and please provide your valuable feedback on this particular app. This is very important for us, because everybody, whenever something is spoken about Ayurveda or something like that, they ask about evidence. So how the evidence will come? Evidence will come only by collecting the data and interpreting it, and finally like presenting it in a certain manner. That's all about evidence. So it does not come from the heaven, or it is not produced only in the laboratories. So that we must understand. So let us all contribute to this particular experience. Please follow all these suggestions and get benefited. So these are the few thoughts which we thought from our institute. I should convey my regards to my assistant director, sir, Dr. P.V. Prasad, and my director general, Shri Vaidya Professor Dhimanji, and all my colleagues at the Ministry of Ayush for coming up with such wonderful guidelines, and especially with that beautiful yoga protocol. So please do learn and become like guardians of your own health. So in this kind of crisis, we have to help ourselves, and followed by this, we have to help our kith and kin. So that's the best way to go. So with this, I would like to wind up, and the session is open for any interruption. Thank you very much. Thanks a lot.
Thank you, sir. Thank you,
Thank
sir.
you so much, sir. Thank you for your valuable suggestions and all. It was a very nice session. Sir, Devraj, sir?
Yes, madam. So if any queries from students, we can take up. Otherwise, I have some queries on behalf of students.
Yes, please.
Sir, in the last session, somebody asked that can we soak in the water, that the almonds and nuts can be soaked in the water and we can consume in the next morning. So in Ayurveda perspective, can you throw some light on this?
Yeah.
Is there any nutritional changes, or what will happen that product
it's not much to do with nutrition basically, because these nuts, if they are not, for example, if you some of the nuts, there may be a problem. For example, some fungal infection may be there sometimes because they are stored for quite some time, and basically this is to like see the integrity of the seed itself. Basically, once you soak it, if it is good, it will swell properly and the consistency will be normal. Otherwise, if it is not proper, or if it is having some kida and all, any insect or infestation, so that is basically a test. Basically, that is the cultural practice fundamental, but it is not a mandatory practice. And Ayurveda also never states that you must soak it and take. There is nothing like that. There is nothing like that. It's basically a cultural practice, like our food handling practice, basically.
Yeah.
So and number two, for some people who cannot chew it, like raw seeds, some people may not be able to handle. So for them, it will be useful. Otherwise, it is not a mandatory thing. Yeah.
Okay. Thank you, sir. Sir, one more thing. We heard during this lockdown and during this COVID-19 situation, we heard a lot about the Ayurveda products like Chavanprash, Estimadu, Ashwagandha, Guduchi. These are all prophylactic, aspects. Can you say something about these products?
Sure. Why it is important? I mean, for example, if you take Guduchi, or say as I said, Ashwagandha. See, the importance of them is, in case of COVID specifically, what happens in the initial, because it is a new virus, our bodies, no one is exposed to this particular alien protein earlier. So once it gets into the body, in the initial stages, first 4 to 5 days, the body does not recognize it basically. And suddenly when it recognizes that some alien thing has come, the whole immunity becomes so hyperactive that there is cytokine storm, and finally all the kind of serious effects. Instead of killing the bacteria, the immune system starts damaging our own body. So that is one of the important pathologies which has been identified with respect to this particular. So then what is the role of Guduchi or say Ashwagandha like things? What they do is, so of course, there are many kinds of immunities that naturally adaptive immunity and all. But how you handle the situation with your immune response should be appropriate. It should not be hyper or it should not be low. So that is the basic idea. So with the kind of herbs like ashwagandha and guduchi, what they do is exactly this. They will ensure that your immune response is very optimum. It is neither hyper nor very low. I mean, they don't make you immunocompromised. For example, we have some medications, for example, steroids and all, if we use, the person tend to become like he become immunocompromised. Though it contains that upsurge of immunity, inflammatory reaction, but there is a problem that the person may become weakened with the immunological this thing and may become susceptible for other kinds of infections. So Guduchi and Ashwagandha like herbs, what they do is if you consume them in little quantities over a period of time, they prepare your body environment in such a way that for any kind of infection, it need not be COVID, for any kind of infection, the immunity response become optimized, and it will only kill the enemy, not damage the body. So the damage to the body is minimized. In that way, they help protect the integrity of the body. Not only Ashwagandha and Guduchi, I want to tell you, there are many studies with respect to yoga and pranayama which come up with this kind of benefit. And people who generally have these good, healthy lifestyle habits, they do have this kind of response. It is something like this. I will tell you an example. For example, in general, in India, we don't have the practice of running and doing aerobic exercises, unfortunately. But if you compare an athlete, even after running for 5 hours, their heart rate does not increase much, even with quick running also. Why? Because they have adapted to it and their heart is responding in a normal way. So if we do it without, what happens for a layman, the heart races up and they end up gasping, and if they do more, and sometimes there will be arrhythmias and certain serious problems also. So similarly, if you train your body over a period of time to respond appropriately to any kind of immunological overreaction, so we get this kind of benefits. So these are the few remedies which are time tested in India. So anybody can do. If somebody does not want to take a medication, they can take the help of yoga and pranayama and beautiful aerobic exercise. There are so many aspects of this. So whichever is convenient for people, they can pick up that and practice. So more so, what we have to understand here is, in case of COVID, so our immune response, we should get ready, because in the absence of any kind of vaccination, so we should ensure that our body is not overreacting, it is optimally reacting, and if somebody is getting infected, they are recovering faster. So that is the whole idea. So that's the reason we are having n number of different kind of approaches put in place to ensure our safety. Physical distancing, and taking all the measures of like maintaining distance and the alternative work schedules, how to handle the food, and apart from that, how to handle your own self, how you react is what all the Ayush is concerned about. Basically, that's why we keep on advising about what food you have to take, and what kind of nuts you have to consume, and what kind of yoga you have to do. So it's a combination of all the efforts put together, we can win this situation. So yeah, that's ideas.
Thank you, sir. Thank you. Madam.
Good afternoon, sir.
Yeah.
Very good.
Very informative lecture, sir. Thank you very much. Sir, as per Ayurveda, can you suggest the foods that can be avoided to reduce the cytokine storm, like in COVID and also other viral infection or in allergic bronchitis?
What do you say? You want an advice or what to avoid? It was not clear.
The foods that can be avoided, sir. The foods that can be avoided to reduce.
Got it. Yeah. This avoiding concept we have to understand a little. Ayurveda, we call it pathya and apathya. Pathya means which is good for our body channels. Patha means it is a channel. Apatya means which is not good for us. But in cultural language practice, pathya means people think that what is to be avoided. It is not correct actually. That is one clarification I want to give in the beginning itself. So what is good is all what we spoke in the earlier slides, like all that warm water to like mixing of haldi and all those kind of things. Basically prepared fresh food, and what all Dr. Santosh and our other speaker has spoken, all that food in a fresh food you can take, and that will save the grace. What has to be avoided is mostly depends upon the individual temperament, but as a blanket, whichever increases the irritation, mucosal irritation, like for example, consuming high chilies, for example, or taking off more of tamarind. I'm talking about quantity here. Nowhere I'm saying that you must completely avoid it or take only this. That is not the way Ayurveda works. It's all about quantity and it's all about individual response. Some people tolerate, but some people do not tolerate. So you have to test yourself. If something is working out, better avoid. That is the general advice. But on the whole, the whatever is the food substance which has a tendency to increase the mucosal irritation and mucosal secretion, nasal secretion or lacrimation. So that has to be avoided. Whether it is a very cold ice cream, whether it is hot chili, or whether it is tamarind, or say high more quantity of lemon, or say fruit juices and cool drinks, beverages, high sugar content things. All these things tend to in the mucosa and increase the secretion, which like you become a sitting duck ultimately. So you become a sitting duck. You are, for example, if you consume a lot of cool drinks and your appetite goes down, so who is at fault? So you are only inviting the problem. So these kind of things we have to avoid anyway. So the general advice is to go for fresh food, which is not having very high sour or very high salt or high pungent. So here the most focus should be on the salt, is basically. So in India, we have this tendency of consuming a lot of salt, which has a tendency to weaken immune system. Salt and especially all these kind of sodium soda, like soda bicarbonate and all this we add to the food. All these kind of things we have to avoid. So it is basically high salt and very high spicy diet, and also which all irritate the mucosa has to be avoided. So that's a general advice.
Thank you very much, sir.
Madam? Madam? Hello, sir? Sir, can you hear me?
Yeah, I can hear.
Yeah. Sir, you talk about that individuality and the temperament. Does anything to do with the prakriti of an individual for this COVID, who has to take care of that himself?
Yeah, sir, Ayurveda has clearly identified this concept. Yes, of course, individual differences do matter, but we call this kind of pandemic situation as Janapadodvamsa in Ayurveda. Janapadodvamsa, like mass kind of destruction or threat to the humanity. In this kind of situation, these subtle individual differences should not be considered. That is the dictum of Ayurveda. So here everybody is equally susceptible, and this goes in hand with our current day guidelines also. As Dr. Santosh has pointed out, respect everybody, suspect everybody. So there is no kind of dichotomy or kind of say that the Pitta Prakriti is susceptible or Vata Prakriti is susceptible or Kapha Prakriti is susceptible. That does not hold in any way in kind of a Janapada like situation. Yeah, but as far as the susceptibility, once one acquires this infection, who will land up in trouble quickly are those chances are more per se because the Pitta Prakriti people they're just like sort of fiery kind of people, in the sense they acquire things very fastly and their destruction rate is also very high, especially the cytokine storm, like inflammatory situations are more in Pitta Prakriti. So we assume, of course, some studies are going on, still we have to observe many kind of such scenarios. So those people, I presume that there is more tendency of them landing quickly in trouble. Of course, Kapha Prakriti people do have this kind of tendency. And of course, this is still the picture has to emerge. But anyway, as I said, as far as acquiring or getting an infection is concerned, everybody is equally like susceptible. So we should not think about these kind of subtle differences in kind of a pandemic-like situation. Yeah.
Okay, sir. Thank you. Thank you. Thanks for a wonderful talk on the Ayurveda perspective. Madam?
Sir. Sir,
Madam, can we end the session?
Yeah, if everything is over, you have to speak anything, sir, from your side?
No, madam.
No. Okay. So then we will end the session. Before that, I would like to say everything. So it was a very wonderful session, sir. Starting from Santosh Kumar, sir, who said that you cannot change, you cannot go back and change the things, but you can only go forward and change the things. So let us learn new techniques. I mean, these are all the techniques that we had been using in our in an Indian scenario. All the way of our food, the way how we live, and all those things. Actually, they are there from the beginning. But only thing we had to recognize it in a new manner. So thanks to this, I think Corona and all, we need to thank it also, so that we are realizing what we are actually and why we are better than everything. So in some ways we need to thank it also. And it was a very wonderful session from Santosh Kumar sir and Raja Rizwan Mamidi, who gave a very nice concept of nutrition. And you have given a very nice session on Ayurvedic aspects of this thing, nutrition and yoga, the importance of yoga and all. It was a wonderful session. Everybody have really, it was an apt situation for the current scenario. And we really thank you all that you had come with a very short notice, I suppose. All of you have been, so we have your way of coming to us. It was quite encouraging to all of us. And we hope to have the same kind of thing from you all, sir. And thank you so much, each and everybody. I really thank all the sessions. And special thanks to Devraj sir also, who had been coordinating and all. And this NIN thing, they are actually much associated to our college and all. So the one moment and one word of a thing, they have accepted our invitation. It's a very great thing. And arranging all the people and all, in spite of your busy schedule. Sir was telling that you had a meeting and all. In spite of all that, you had been here, you made your time to come and schedule our Zoom meeting. It is really wonderful from you people, sir. Thank you so much. And looking ahead for such more meetings from you all people. Thank you, sir.
Thank
And
you.
at the same time, I also thank all of them who had been there in this session. The lecturers, the faculty, the teachers, and everybody. And I especially thank the zonal coordinator and JS, Dr. Praveen Mamidala, who had come to the inauguration session, and zonal coordinator Manu, who has been continuously in support to all of us. And I also thank all the students who had come to us and who had attended the meeting, and they had been very nicely sitting and listening to all of us and everything. I thank the OSD and everybody who had been in support to all of us. A special thanks to our faculty and all. Thank you so much, sir. And thank you for all the parents also who had been, who had given their phones and their internets and everything so that the children could be online with us, and all these things and all to happen very properly. So I thank each and every one, sir. Thank you so much. Thank you, and thank you so much, sir.
Thank you.
And one more thing, sir, one more thing I just forgot to tell. All these forms, I think you have seen the forms and all. If you want to send the forms to other people also, those who want participation certificates, anything like that, you can actually send it to us. After filling the form, we'll give you the participation certificates also. Just inform everybody, sir, because we have sent some groups and all there also. Everywhere we are going to get it.
Sure, madam. Sure. Madam, can you share the link of this YouTube, recorded YouTube?
Madam Rajini, madam, do you want to speak anything, ma'am?
Sir is asking something.
Yes, sir.
Share the link. Sir is asking something.
Okay, it is there. Yeah, I'll give it to you, sir. I will share it in the thing, but actually in the chats is already there. It is already there in the chat. I will send you personally also to your WhatsApp number.
Okay.
Okay, sir.
Okay.
Yeah. Thank you, ma. Nothing is there. Thank you very much for providing such a wonderful session. Each and every session was good and varied and then good and practically implementable things were said by all the resource persons. Thank you, sir. Thank you very much, all of you. Thank you, ma.
Thank you. So we'll end up for the day, sir. Thank you so much.